Hello, good morning, everybody. Welcome. Let's kick off today's session, this morning's session. Welcome to the Queen's Health Talk on fibroids, endometriosis and polycystic ovaries. Today, we are going to be exploring and discussing all the implications with some eminent people in the area around fibroids, endometriosis and polycystic ovaries. So, what I always say every week, please have your pens, pads, notebooks ready to take down notes. Please post any questions into the chat. I've got my fantastic co-host, Nadia Mark, who's going to be monitoring the chat for me, and we'll pick up any questions, saying themes then. And there will be a question and answer session at the end, whereby you can ask our presenters any questions. All right? So, welcome again, and good morning, good evening, good night, and thank you so much for being on the platform this morning. And welcome to the Kings, if there's any Kings around. So can I get a thumbs up? I know that you're all on board. People are still coming into the Zoom event. Wherever you are in the world, I just want to thank you all again for supporting us and, coming onto the platform. We are predominantly a walking group. So for those of you who haven't been on the platform before, I'll just give you a quick bit of background history. So we are predominantly a walking group, and we would normally be walking on a Saturday morning at 8 o'clock. But unfortunately, due to the pandemic and the government restrictions, and the one that really kind of knocked it on the head for us was the mere fact that only one person could meet with another person from a different household to exercise. So therefore, we've been Zooming for the last couple of months, and we've had an absolute blast. We've covered an array of different topics, and it's been absolutely fantastic. So we've done Queen's Black Hair Rocks, we've done Queen's We Ain't Crazy, It's Only the Menopause, we've done Queen's Breaking the Silence, Let's Talk About Mental Health, we've done Queen's Stop Eating the Fridge, Let's Talk About Diet and Nutrition. And a spin-off from that has been, there's a group of 60 of us, and we've been on a 30-day intermittent fasting challenge. And that has been an absolutely amazing experience. Amazing. Learning about, different foods we can eat, having a dedicated eating window between 12 and 8. So it's been amazing, and the transformation and testimonials that have been coming through, especially on our WhatsApp group, it's been mind-blowing. People who thought they couldn't, stop the certain bad habits. It's been a huge transition for many of the people on the group. It's been absolutely fantastic. We've done a couple of Black business events as well on the platform, and we've got one next week, in actual fact. So that will be dedicated to children. So we're going to have a panel discussion, and then we're going to have businesses that are predominantly providing services and products to children. So we'll have an author, we'll have a lady who's created a game for her child, we'll have a lady who does black dolls. So we'll have an array of different business owners, vendors on the platform talking about their business and showcasing their products. So that's going to be really, really, really exciting. We've also got a number of Zooms coming up. So, and we also did love, sex and relationships last week, and we're going to do a part 2, because we need to kind of get a lot deeper into this love, sex and relationships. That was a phenomenal event, really, really good. So what have we got coming up? We've got Queen's International Black Hair Rocks. And don't our hair rock? Whether you've got locks, you've got weave, you've got plaits, whatever style you're rocking, natural, I'm telling you, we are going to be celebrating our black hair. It's going to be an absolutely fantastic Zoom event. I'm so looking forward to that. I've got so many ideas buzzing in my head. It's going to be amazing. We've got another health talk coming up. We're going to have a series, because there are lots of different, conditions that affect our community predominantly. So it's going to be Just going to ask my colleague to mute everybody because I can hear something in the background. Yeah. So we're going to have a series of health talks. So today, you're all on the platform for fibroids, endometriosis and polycystic ovaries. We're going to be doing a series. We're going to have a talk about diabetes. We're going to be talking about prostate cancer. We're going to be talking about pain. There's a whole raft of different topics we're going to have specifically in the Queen's Health series. So that's going to be amazing again. We're actually going to be also doing an early morning spiritual mind, body and soul retreat. I'm so looking forward to that. And the list goes on. Yes, the list goes on. So yes, we have an amazing array of different Zoom events that are going to be coming up. So to hear about future Queen's Walking Group exciting events, please follow us on Eventbrite. That's the only way you're going to be able to know instantly what's going to be happening with us. And it's every week it's something different. There's no kind of like consecutive pattern here. Whatever comes into my head, I think, oh, this would be a good topic to do. And that's how we roll. This Zoom event is being recorded and will be released on our YouTube channel. And this week, we actually uploaded 4 Zooms. So the menopause ones, part 1 and part 2, are now up on YouTube. The Black Hair Rocks, part 1 and part 2 are also up on YouTube. And we also uploaded the Queen's Breaking the Silence, Let's Talk About Mental Health. Yeah, so they are actually going up onto the YouTube channel now. So please, check us out, like, subscribe, comment, share. Really appreciate the support. So have your pens and paper, your pads ready for some life-changing information. It's going to be an absolutely fantastic event this morning. And it's really about, as individuals, we'll give you the information and for you to make the decisions, and take away some really good, authentic knowledge. Yeah, because we always have an array of fantastic speakers on our platform. And it's all about our health. So let's get ready to kick off today's session, Queens. Health talk on fibroids, endometriosis and polycystic ovaries. So Queens, these are conditions that are more prevalent.
I don't know.
To mute everybody, please. Thank you. So these are conditions that, seem to affect, for some reason, predominantly our community. So if you're suffering with like the heavy periods, tummy pain, abdominal pain, lower back pain, frequent need to go to the toilet, constipation, discomfort during sex, weight gain, thinning hair, hair loss, skin acne, these are all symptoms of what's going on in regards to these particular conditions. So I want to give a big shout out so you know that the presenters are real and they're really here on the platform. So can I ask Dr. Aaron Arthur to say a quick hello to the guests on the platform?
Hi, good morning, everyone. Hi, nice to meet you all.
Wonderful. We also have the phenomenal, the beautiful Dr. Adora. Are you here?
I am here. Thank you so much, everyone, for tuning in.
Wonderful. Imani, the wonderful Imani.
Morning, everyone. Nice to meet you all.
Valerie.
Greetings. Nice to meet you all.
Good, good. Kendaki.
Greetings. Wonderful to be here. Blessed.
Oh, fantastic. So, Kentucky, let's kick off with you. And I've always got some questions. And we like to ask questions. This is a good platform to be able to do this, to get the expertise and the knowledge from, these professionals in our community. So fibroids can affect women of reproductive age, but Black women are more likely to develop them. Why is that? Why is the data driven and displaying this, kind of phenomenon in our community?
Okay, thank you. many years ago, when we used to look at fibroids, studies were done here in like the UK and the States, and then also in places like Nigeria. And they found that actually the prevalence was similar. So we thought maybe, you know, because we had come into the diaspora and the fact that we'd gone through slavery and all of that, okay, but they found that, you know, there was just as many cases. Studies which are coming out now, because this question keeps being asked, looks at the possibility, and I don't like using this word, obesity. So they say that Black women may be more obese than, you know, bigger, right? Possibly. And that may be a factor in terms of the estrogen levels. There are other factors that may be involved. And so racial discrimination has actually come into the mix, possibility of racial discrimination. And the fact that emits hormones, and in my presentation I'll talk a little bit about hormones and that. And then also childhood trauma, those kind of things may be factors as to why Black women. So those are some of the things that are coming out. But to be honest, I don't think anyone really knows, or people are still trying to understand why it is that Black women tend to have higher incidence of fibroids. So that's the best I can give you, my sister.
No, that's fine. That's fine. There really isn't a definitive answer, but there's thoughts, isn't there? There are thoughts. So please tell us a little bit about yourself before you kick off your presentation, so people know who.
Right.
Know your credentials.
Okay. All right. Thank you. And again, thank you so much for having me on board. And even before I start, I just want to acknowledge the divine world and acknowledge my ancestors, those whose shoulders on which we stand. So my name is Valerie Mckenn. I'll start from the part that most people understand, and that's having a degree in medical herbalism. So I am trained similar to a doctor. We do things like clinical skills, pathophysiology, pharmacology, and all the sciences. That's our training, but we do not use pharmaceuticals. So then our training goes further now in understanding the science with herbal medicine, nutrition, drug-herb interactions, lifestyle, and how that affects the person. I've been in clinical practice for 12 years, working in a team setting. I've worked alongside endocrinologists, gynecologists, diabetic specialists, osteopaths, sports scientists. So I've worked in a team setting, and that's really good because it gives the person different mindsets can approach a particular clinical presentation in different ways. So that's really wonderful. But I also like to say, I've also come from a Rastafari background where we deal with natural, and that's over 30 years dealing with natural science. And again, when I go into the presentation, I'm going to speak about that because that's key, understanding that we are part of the nature. And I've also been training with the Dogon people of West Africa, studying traditional medicine and traditional African science for the last 7 years. And I also do things like food projects in schools and food growing because I'm very much around the holistic health side of things.
That's fantastic. So that is you in a nutshell. And there's more, isn't there? There is a lot more. So my darling, please share your knowledge with us. So looking forward to the presentation.
Thank you. So I'm going to just try and do this as briefly as I can. Do I have the ability to share? Yes,
you do, my darling.
Okay, so let me know if you can see my screen.
You've started sharing now.
Okay, slideshow from the beginning. So I've taken it from the angle of dealing with hormones.
Just need to make it a bit bigger so we can see it. We can't see it fully on the screen. Oh, that's it. Fantastic. Thank you.
Okay, excellent. Okay, so I'm going to just power through this. So I've come at an approach of dealing with hormones naturally, but I'm going to come at it from a holistic perspective. So just to understand a holistic approach to health, we deal with it top down. So the first thing is to understand it's the nature, and we are made from the nature. We're just a part of the nature. So, but to understand that, it's mind, body, spirit, it's also the environment. So when we look at disease, we're not just looking at that specific disease in itself and looking at how to just zap that, but we're looking at the whole person. So that's key. And just to say that the World Health Organization's definition of health is in fact a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So you're looking at a more holistic view, but we go further and look at the environment. So here we look at factors that can affect your health and well-being, and all of these do play a role in the human being's experience. And so I've just put some things that can affect your well-being, things like stress, your thoughts, your environment, where you live. You know, you've got the moon and the stars, the planets. Do they affect your health? Yes, they do affect your health and well-being. Can it affect your hormonal levels? We'll look at that. Nutrition. Okay, so the human being is mind, body and spirit. And when you're looking at the human being, although we are talking about a physical aspect, so it might be a benign tumor like fibroids, or it might be an inflammatory condition, that is the physical aspect of the human being, and other aspects of the human being impact on your health and well-being, your psyche, your emotions, and they have a direct effect on the physical body. And there's a field of science called psychoneuroimmunology that looks at the biological pathways of stress and how it leads to disease and disease processes. So let's get to the physical part of the human being, which is the human physical body. Now, the human body has 11 systems. They're actually looking at another one, but okay, let's use the terminology that has 11 systems. The system that we're going to look at specifically is the endocrine system. Now, that is a system that's responsible for the hormones. And during the cycle, because everything is connected to nature, and that is so key to understand, that the human being is interconnected into the nature. So this whole idea of the circadian cycle, these biological rhythms that govern the human body, and any science is really a study of the nature. So nature is that one that has everything is within nature, and then we study it to understand it. So the endocrine system, which is just one of the systems in the human being, is the one that's responsible for the hormones that govern the reproductive cycle. And one of those hormones that are involved in the cycle is estrogen. And estrogen is a factor in something like fibroids. Now, fibroids, and the doctors are going to speak more, and I'm sure the other presenters will speak more, so I'm going to not speak too much on that. I just want to speak on the hormonal aspect, and then how we can look at holistically managing the hormonal aspect. So as you said earlier, between the reproductive years, we know that things like fibroids grow, and estrogen is a key component in that, in the presence of estrogen, it is understood that fibroids enlarge. Now, there are some other factors, and this is why we look at the whole person. So, for example, the fact that people are having less children, well, that means that we are in a more estrogen dominant state, because we're carrying, you know, for 9 months, if you think about it, you'd have, you know, a child in your womb, and then you'd be breastfeeding. All of that means that your estrogen levels are lower over longer periods of time. Children, menarche starts earlier, so children are now being exposed to estrogen at an earlier age because of the fact that they're starting their menstruation earlier. I'm just going to go over a couple. Obesity, which when you asked about why Black women may possibly be, well, the fact that we do have fibroids more than other women, but why obesity has been suggested, and the fact that we're in more estrogen dominance when you're overweight. But there are other factors. Xenoestrogens, those things that are found in our environment, also interact with those receptors in our body that the estrogen molecule would go into. And in doing that, so for example, say fibroids, when that is exposed to kind of estrogen, it grows in the presence of estrogen. So these xenoestrogens have been implicated, and there's studies by the Environment Exposure and Risk and Uterine Lymphoma and epidemiological survey they carried out, and this study, and they found, there's been many, but I'm just referring to that one, that estrogen actually has an impact. Trauma that also came up under Black women. The fact that trauma is indicated, and that is connected with stress, and there isn't much time to speak about that, but just to bear that in mind. So that's why we look at things holistically. And again, there's a research on that by the American Journal of Obstetrics and Gynecology, which looks at that. Now let's get to the natural ways of dealing with estrogen excess. Now, so that really was just a kind of whistle stop, just to give some idea of like the other factors that are involved. Exercise, why is that so important? Well, as human beings, we're made for movement. And there are studies done by the Public Health Science Division. They did a study. They were dealing with cancer, but they were looking at the study and seeing how exercise reduces significantly circulating estrogen. And that becomes important because many times the kind of environment that we live in, the foods that we're eating, the stresses that are there, we're not getting the estrogen being released out of the body. If it's not being released, then it's circulating in the body. If it's still circulating in the body, then it means that these, benign tumors are in the presence of estrogen, more estrogen. So this again can cause things like fibroid growth. Let's just move on quickly. Xenoestrogen, we spoke a little bit about those environmental estrogens. They are key, especially if we're living in the cities. It's so important. So what are some of the environmental estrogens? Well, here we have some of them. The contraceptive pill being released into the environment through the, flushing into the toilet, going through the water table into the system. They've found that this particular part of the oral contraceptives, and it's ethinylestradiol. Estradiol is an estrogen, because estrogen's kind of lumped together, but it's actually 3. That has an effect, and these are these xenoestrogens, the estrogens that come from outside. Atrazine, which is a weed killer. Many of the preservatives on the food have these xenoestrogen components, because we have to remember that, again, we're made up from nature. And when these products are being put together, man doesn't invent. They have to make from what's around them, natural chemistry. But these things affect us adversely. Things like food dyes, sunscreen, bisphenol A in plastic, these are some of the things that have been indicated in these xenohormones that are in our environment that make their way, migrate into our body. Okay, how can we deal with this naturally? Now, fiber has been shown. Now, sometimes in this world we think, oh, well, why, fiber, diet, nutrition, because we've become so technical minded and think just on the technical side that we don't realize we are made from the nature. The human body is made from the earth. From the day we are born to the day we die, it's the food that we eat that makes us grow, that fixes our cells. Nothing but that natural phenomena. So it is therefore the same nature that will have the biochemicals or the chemistry within it to heal our bodies, because we're made from the earth. The human body is made from the calcium, potassium, magnesium. And so for the body to repair itself, it needs to feed from that which it came from. So therefore, you have to look at specific things when you're dealing, for example, with estrogen excess. We find that fiber helps to get rid of that out of the body. And here's some of the fiber and the foods that help to get rid of that circulating estrogen. The other thing is that the liver, and I'm not going to speak much about the liver, but the liver, which works in like 2 phases, but the liver is a key organ in the body that helps to get rid of excess estrogen. So again, what we're saying is a holistic approach. You need to also look at not only your diet, but actually helping the liver to clear. The liver takes on the bulk of the work in the body. When you eat, your food goes to the liver, and the liver then does what it has to do to take to send it to the heart, and the heart pumps it around the body. So the liver is key in helping to get rid of estrogen, and then in that way now we would look at certain herbs like liver herbs that helps to clear the liver, that helps the liver to function. But I'm going to not look at liver herbs. I have a course, so you can talk about that a bit later. And the course, you can talk about certain things with the liver, but certainly the liver is one approach. I'm just going to finish off now on phytoestrogens. So in nutrition, you get phytoestrogen, but specifically talking about herbal medicine, you have plants that are phytoestrogens, and how they work. Those same receptors that we spoke about that are on the fibroids, for example, phytoestrogens take up those receptors. So instead of the body's normal estrogen taking up those receptors, the plant chemicals take up those estrogen receptors. Now, what it does is that it has a weaker effect on the tissue, whether it be a tumor or otherwise, in terms of its ability to grow. So in that way, it's called competitive inhibition, where it stops the body's natural estrogen attaching to these receptors, and the phytochemicals, the plant chemicals, take up that space, and by doing so, they reduce the effects of estrogen. And so this is a key one that's known. One that we looked at was red clover. There are many phytoestrogens, and a key one here is simicifuga. It has things like triterpene and glycosides, which are chemical components. And I just want to finish here with a study, for example, that was done on Black cohosh. And there are many female issues that it helps. So it showed how it works in menopausal symptoms, hot flashes, sweats, irritability, and so forth. But what it does, so do you remember we spoke about the endocrine system, and there is a part in the brain called the hypothalamus, and that hypothalamus releases a particular hormone that goes to the pituitary. Now, these herbs act at that level. So that cycle that we spoke about, that reproductive cycle, which starts from the hypothalamus, which goes to the pituitary, and then to the reproductive system, that they enter in at that level and help to balance the hormones at that level. So we are using plants in a very natural way, just like we would use food. We then take it to another level and we use plants. So this particular research was carried out by Dr. Mayo, and it was published in the Advanced Nutrition publication. So that was on Black cohosh. There are many other herbs that can be used in that way. And so just to finish off, there is a course that I'm doing on holistic health and herbal medicine. If you want to know more, I'll drop that information into the chat box. But also there's one specifically looking at women's health that starts next week, where what I've covered here, we're going to go into much more depth. We're going to look at the reproductive system, the hormone cycles, the herbs, and understand how this works and how stress affects our fibroids, endometriosis, etc., etc. Thank you for listening. That's my presentation.
Oh, wow. And that, absolutely fantastic. And it's like you said, exercise, and people who know me, exercise is key to get the balance, as well as, you know, the sleep, nutrition, etc. So that is key. So I hope, you know, people have taken that on board. What's it called? Xenoestrogens.
Xenoestrogens, yeah.
Is that a new kind of?
No. What happens is, within the world of science, it's known, but what happens is, before it gets to the public, it's just circulating. So it's known within the medical fields and the scientific fields. It takes a while to get up to the public. So these are well-known, well-researched, well-understood factors that affect us. So yeah, xenoestrogen, these are stuff that's out there. Yeah.
And good sources of fiber, you know, for me, it just kind of like brought the message home more. And I'm so glad, you know, that, you know, back in sort of like January, I thought, right, let's do this intermittent fasting, you know, as well as doing intermittent fasting, it's really educated us around food And, you know, and all these things that you had on the slide, you know, dark leafy greens, broccoli, Swiss chard, whole grains, that is my diet now, you know.
And, you know, it's so important because, you know, people, the human being, I think, has become arrogant where we just think, oh, it's just a leaf, not understanding that these are the phytochemicals that build the very cells that are in our body. Yeah. So when we think that we can surpass nature, we soon pay for it. And that's why we see all these disease processes. So yeah, going back to nature and eating that which you came for can then give the body the phytochemicals it needs to carry out its job. Carry out the function it needs to carry out. So it's key.
It is key. I mean, you know, even, you know, when I start on a Zoom session, I always say, have your pens and paper and have your pad to take notes. I mean, I've got loads of notes here, so I'm just going to quickly whiz through some of the stuff I've written down. A lot of my friends have started doing liver cleanses.
Yes.
Whether it's a fad or, you know, but
no. And you see, this is the thing. I think it's so disingenuous to really, you know, say that liver cleansing or that kind of thing, you know, it doesn't have any merit, because the fact is, again, if we go to the basic, the human being, for us to grow, none of us, you know, all of us have to eat food. As a baby, you come and the baby's already opening its mouth to eat food. So it knows already, without anybody telling it, that it needs to eat. And it's that nutrient which you put in the body, which grows you. Now, so for then now a human being to turn around and say, well, oh, to cleanse the liver. I mean, you don't know. What do you know about the nature? You came in, you found the nature and you studied it. That's what science is, a study of the nature. But we have an arrogance where somehow we feel that we are above the nature. No, you know, everybody has to breathe, eat and sleep to live in this zone. You know, that's the reality. None of us say to our heart, keep beating and then I'll wait, you know, I'll take over in the morning, or keep breathing. No, all of us are subject to nature. That's the reality. And so for us, it's about respecting and then learning from nature and trying to understand. And again, coming from a holistic background, working with doctors, working with other professionals, you know, you see the benefit of having, you know, different paradigms for people to work with, but all have their place. So, yeah.
Fantastic, thank you. And what's your view? Another quick question. What's your view around CMOS?
Yeah, you know, even when I was in the Caribbean in Jamaica, I've used sea moss for things like respiratory issues with garlic, helping to get cold and things out of the body. But we use it traditionally to strengthen our body and so forth. So, you know, sea moss can be used in many ways. Yeah.
Fantastic. I think my co-host is hinting at me.
Okay. So I'm going to drop the information into the chat for if anybody's interested in the course. Thank you.
I normally say, you know, for all the presenters, could you please put your contact details into the chat, because I know, I mean, we've got over 200 guests on the platform who are going to want to you know, hook up with you guys and seek out further information. So thank you ever so much.
Thank you for having me. Bless.
We'll be around at the end for the Q&A. Yes. I'm sure people have loads and loads of questions. Yeah. Thank you, my darling. Beautiful. Right. Next, we have got the fantastic Dr. Aaron Arthur and Adora. Where are you? Good morning. Good morning. You said morning earlier to us.
Yeah, sorry. I was on mute.
Right, so hello, good morning, welcome to the platform. Please tell us a little bit about yourselves, and I've actually got some questions I want to ask you. So Aaron, do you want to go first?
Yeah, sure. Good morning, everyone, and just want to say thank you for having me on this platform today. I do appreciate it, and it's an honour to be here.
We love having you. We've actually got a man. Normally it's like 200-300 women.
glad to represent. Yeah, so I'm a GP, and I have a background with previous training in women's health and some training in medical education. The reason why I participated today is partly because I had a meeting with Joan and she sold me with her enthusiasm. She sounds like she's really passionate about women's health and she won me over. So that was part of the reason why I did this. And the other reason is because I have a close family member who suffered from one of the conditions that I'm about to talk about, and she suffered from it quite badly. So I felt it was incumbent on me to have this kind of discussion and spread awareness about the condition. So yeah, thanks for having me, and I hope I can impart some knowledge.
Fantastic. And Adora, who's going to be doing the presentation with you. Good morning, beautiful Adora.
Morning.
I haven't said your surname because I'm not sure how to pronounce it, so please.
No, it's fine. It's Endometriosis.
I'm still not going to try and pronounce it.
It's okay. It's okay. Adora's fine. Dr. Endometriosis is fine. But yeah, thank you so
Thank you
much
for coming on the platform. So please tell us a little bit about yourself before you kick off
of course.
the session.
So Aaron let me know about this opportunity, and we go way back to medical school. And as soon as he told me, I was well up for it. I am also a doctor. I am a little bit behind Aaron, so I'm about this much away from becoming a GP. So I'm a GP registrar, hopefully qualifying in the next couple of months. I have obviously such an interest in women's health, and specifically healthcare and how it affects us as Black people. To that end, I actually set up a podcast with one of my fellow doctor friends a couple of years ago called the Glowdox Podcast. We're on Instagram, but also on Spotify and iTunes, and we talk about all these sorts of issues every 2 weeks. So we try to educate people on lots of different things regarding health and lifestyle, but with a specific emphasis on Black people and women, because that's what we are. And I've been getting involved in these sorts of discussions, just a lot recently, and on Clubhouse, etc. So yeah, very happy to be here.
Yes, I've heard about Clubhouse. People keep telling me about Clubhouse.
Yeah, we actually, funny enough, it's funny how this worked, because we actually did a talk on Clubhouse on Thursday about similar issues. So I directed people to come and join in today. So hopefully we've got some people in the audience that were in that Clubhouse chat and wanted to get a bit more information.
Oh, brilliant, brilliant. So welcome. So it's just such an honor to have two, GPs. Had Kandaki's herbalist doctor, so we're going to have it from the medical side. So wonderful. So please, I want to ask you, Adora, endometriosis is a health problem that many women face, particularly Black women, in fact. So endometriosis is cited as the single most common cause of chronic pelvic pain in women. Why is that?
The problem with endometriosis, and unfortunately similar to fibroids and PCOS, is that we just don't have that much information about it. What we do know about endometriosis is limited in general. I think for the longest time, people were put down as being pain-seeking or having pain, chronic pain, and there wasn't even knowledge that endometriosis was an issue for the longest time. Since we've realized that it's an issue, I think the difficulty specifically with endometriosis comes from how you investigate it. Endometriosis, just not to go into too much detail, because I know lots of people will be covering it later on, but endometriosis is essentially the lining of your uterus. That tissue is found outside of the uterus, so in different parts of the pelvis. And when that endometrial tissue goes through the normal changes that would happen with your menstrual cycle and your hormones, it starts proliferating and bleeding and shedding and doing all that sort of stuff, but outside of the uterus, which causes tremendous amounts of pain. The problem with it is that you can't see it. So you can't see those little bits of tissue on ultrasound scans. You can't see it really on CT scans. People are sort of, you can see sometimes in reports now from radiologists, sometimes, I don't know if Aaron will back me up on this, but sometimes I see, possibly endometrial. But the reality is that you can't actually see endometrial tissue unless you are opened up, in surgery. And that's one of the main issues. So for a lot of time, it's, for patients, and sometimes truthfully for doctors, it's almost like you're treating a phantom symptom, because you can't see it unless you're surgically, looking. So.
Oh, right. I didn't even realize that. I mean, I did my bit of research, but not being able to actually see it. But, the pain and discomfort these women are feeling is real.
Yeah.
So they must feel so, I suppose, disheartened when they go to, a doctor of whatever discipline,
Yeah.
With their symptoms, and because you can't see it.
You can't see it. And if the doctor that you are seeing has, doesn't have much knowledge about it or how to treat it, that makes things worse.
Yeah.
And then you go into the vein of sort of mental health issues, because you've got chronic pain, you don't feel like you're believed, you don't have treatment for this chronic pain, and that can lead to anxiety, depression, and just a worsening cycle. So it can be really tough.
Yeah, and that's why it's so important to have these discussions, especially like within our community, because
100%.
when we did the Queens, we ain't crazy, we're not crazy, it's only the menopause, and so many women contacted me, oh, I've got fibroids, I've got this, I've got all these kind of issues going on. So I'm just so happy that we're able to have yourself and Aaron on the platform to talk about it. And we're going to have loads of questions at the end, and please guests on the platform, put your questions into the chat and we'll pick up some of those as well at the end. So who's going to kick off first? I've got a question for Aaron as well, haven't I?
Yeah.
Dr. Aaron, these are conditions that are more prevalent in the Black female community. All of the conditions that we're talking about this morning. Is there any kind of evidence as to why this is the case?
Yeah, so I think like Kandanke said earlier, it's a difficult one. There's not that much evidence as to what's the specific reason as to why these conditions happen. There's lots of studies out there in regards to risk factors that are linked to it, but in regards to the actual mechanism that leads to it, we don't have a definitive answer. As Kandanke said, there's lots of discussion around estrogen driving all of these processes, but again, even though we know estrogen is linked to it, we don't know what is the spark factor that triggers off these processes, what makes these growths happen in the way that they happen and in the manner that it happens, and why does it happen in certain people and not other people. We don't know. But I think that's part of the things that we need to know, but also we need to have more discussions about what we can do to mitigate our risk. And I think that's what today is about, really focusing on the things that we can do to reduce our risk of getting these conditions.
Okay, fantastic. Thank you very much for that. So who's going to kick off first? You got a presentation?
Yeah, I mean, I do, but I'm talking about PCOS, and Aaron's doing endometriosis and fibroids, so I don't know.
Yeah, maybe I should go first to.
All right.
With Candace.
Yeah, absolutely. Yeah. I am a gentleman though, so usually I'd say ladies first, but I guess given the flow of the situation, I thought I'd just throw that out there. Super. So I will just share my screen. Bear with me 1 second. Is my screen sharing?
Yes, your screen is. If you just make it a bit bigger.
You will do. Bear with me 1 second.
So we can see. Put it on full screen.
Yeah, will do.
Excellent.
We good to go?
Brilliant.
Fantastic. So hi again, once again. My name's Dr. Arthur, and yeah, I'm going to do a presentation on fibroids and also endometriosis. So with both conditions, what I'm going to do is give things from a medical point of view. I think Kandanke did a fantastic presentation, and she actually covered some of the things that I was going to talk about today. So she saved me 5 minutes. I'm actually happy with that. But I may just go over some of the aspects she went over as well. And then, yeah, what I'm mainly focused on today is what these conditions are, risk factors, things you can do, things that are outside of your power to control, how they present, how they're diagnosed, treatment, and complications, and things relating to fertility, etc. So what are fibroids? So fibroids are essentially non-cancerous growths, and I stress the part that they're non-cancerous, and they mainly grow within the womb or just outside of the womb. They're made of muscles and fibrous tissue, and they usually occur in women of reproductive age. They can grow from any size, so they can be as small as a pea, or they can be as big as a grapefruit, if not bigger. So it completely varies and it differs from person to person. as I mentioned before, it usually occurs in women of reproductive age. So when women tend to get older, the fibroids tend to shrink. And that's partly because it's driven by estrogen. And when you get older, when you're in that menopausal period, your estrogen levels reduce. It's difficult to know how many people exactly it affects, and that's because there's a lot of women walking around with fibroids in them and they don't know about them because they're so small and don't cause any symptoms. So it's difficult to ascertain the actual burden of the disease. However, it's suggested that it affects between 2 to 4 out of 10 women of reproductive age, as I mentioned before. And as we've, I'm sure most are aware now, it tends to occur more in Afro-Caribbean women. And we don't really know why that is per se, but we do know that for some reason, Black women tend to have larger fibroids and have more symptoms from them. There's lots of risk factors involved in the condition. Some of them we know quite well, some of them not so much. Kandanke summarized quite a lot of these already, but there was some of us I just wanted to quickly skate over. So as I mentioned before, there's certain things that are outside of your power with controlling. So the fact that you're Black, the fact that you have the fact that you're Black, you can't change that, isn't it? So that's a risk factor that you have that you can't help. A family history of the condition increases your risk of developing it as well. So first degree relatives who've had fibroids increase your risk as well. Again, that's something that's outside of your control. Now, there's lots of different things you can do to help mitigate your risk to some degree. And Kandanke summed up some of those already. But with the studies I looked at, those studies looking at the role of vitamin D and increasing your risk. So a study that I looked at showed that vitamin D deficiency has been linked to potential fibroid growth. That may be related to the role that vitamin D plays in immune modulation, for example. And as was suggested earlier, there's certain foods that can increase your risk. So things like soy milk, which can increase estrogen levels, food preservatives, etc. And there's other underlying medical conditions that can increase your risk. So things like obesity, because obesity is linked with increased insulin resistance and estrogen production. High blood pressure. I don't think high blood pressure itself is a risk factor, but I think it's because of its links with obesity. And then there's issues regarding not having pregnancy. So the understanding behind that is that when the less children you have, the more cycles of estrogen you're exposed to. So every month during your periods, your estrogen levels go up. The more pregnancies you have, that's less estrogen your body's being exposed to in your life period. So you're less likely to develop it because of that. And things like stress have been implicated. And I think the link with stress is that when you have high stress levels, you tend to eat more. That increases, cortisol levels, which is a stress hormone, that increases insulin resistance, and that can also lead to increase in estrogen levels. So in a nutshell, a lot of this stuff is related to estrogen levels increasing your risk, really. There was one study I looked at that was done in the US in 2012 that looked at hair relaxers being a possible risk factor. There's not that much conclusive evidence, but in that study, it suggested that there's certain chemicals in hair products that can potentially increase your risk. But like I said, not that much evidence is out there regarding it. I personally think just go natural, personally. That's what I do, and that's how I get hair as lush as mine. So yeah, I would personally avoid them if possible. So in regards to the types of fibroids, there are 4 main types of fibroids, and they're kind of based on the position of them. So the most common type of fibroid is what we call the intramural fibroids. So those are basically fibroids that occur within, if you look at the picture, they occur within the muscle of the wall of your womb, okay? You can also have submucosal fibroids, and those are fibroids that occur on the inner lining of the womb. You have subserosal fibroids, which occur on the outside lining of the womb. And then you have what we call pedunculated fibroids. So these are basically fibroids that are connected to little stalks, and those can happen inside and outside of the womb. And the problem with these ones is the stalks can kind of twist on themselves. It can be very, very painful. in regards to the symptoms, I kind of broke them up into 3 different classes. So you have symptoms that you can get because of abnormal bleeding. You have symptoms that you can get because of having a large mass in somewhere where it really shouldn't be. And you can have problems with fertility. In regards to bleeding issues, you can have issues with heavy bleeding or painful periods. You can get bleeding in between your periods and during sex. And I think with those two symptoms, I just wanted to highlight them because those 2 symptoms can also occur in other conditions like cervical cancer. So if you do get those kind of symptoms, it's always important to talk to your GP about it, just to discuss whether that's something you need to rule out. Some people may have very innocuous or mild symptoms like tiredness or dizziness, and that's because if you bleed heavily, you can end up getting anemic, which leads to those types of symptoms. In regards to symptoms regarding mass effect, as I mentioned before, I'll talk about that on the next slide because it illustrates it a bit better. And then fertility issues, I'll talk about them again on a later slide. So if you look at the first picture here, just imagine it's your body from a sideways point of view. So if you took one of these massive fibroids here, imagine it was at the front of your womb where your bladder is. So if you had one there, your bladder wouldn't be able to fill as well as it should be. And therefore you're gonna need to go to wee more often than usual. If you had a fibroid at the back of the womb, where your bowels are and where your backbone is, it can press on the bowel and therefore make it difficult to pass stools, and therefore you can become more constipated. And also it can push on your backbone and lead to back pain. If you had a lower fibroid, that could lead to problems with pain during sex. So this is just to highlight that you can have lots of varying different symptoms depending on the size of the fibroid and where the position of the fibroid is. And that's why, people can tend to get different symptoms, and not one person's symptoms is the same from the other person. It varies. In regarding diagnosis of the fibroids, the first line treatment, first line investigation would be something like an ultrasound, because it's something that a GP can organize, they're cheap and easy to arrange. And that usually can show up the fibroids, even small ones, but sometimes those can be missed. And so sometimes you may need further investigations, and that can come in the form of things like hysteroscopies, which is a procedure where a camera is attached to a scope and that's inserted through the vagina and into the womb, and that can allow direct visualization of the fibroids. You may have to go for something a bit more upscale, like a laparoscopy, which is basically keyhole surgery, because as I mentioned before, some of these fibroids can occur outside the womb. So something like a laparoscopy may be needed to directly visualize it, and it can also be removed while the surgeon's in there as well. And sometimes things like CT scans or MRI scans are used. They're not really first line, but sometimes because some of them aren't really showed up well on the ultrasound scans, these modalities may need to be utilized. In regards to management, it depends. Everyone is different. So it depends on the kind of symptoms you're having, really. For some people, you can take a watch and wait approach. So like I said, if you have a tiny fibroid that's the size of the pea, not causing you any problems at all, as the saying goes, if it ain't broke, don't fix it. So if you're not having any problems with it at all, then you don't need to do anything. From a GP point of view, there's different options that your GP can offer you. So there's things like tranexamic acid and methylamic acid, which are basically in the same family of things like ibuprofen. So those help with the painful and heavy bleeding that you can get with this condition. And you can also be offered different types of contraceptions, depending on what's more appropriate for you. So for some people, just as an example, the combined pill, which contains estrogen and a hormone called progesterone, may not be beneficial to you because you might have a history of blood clots or issues with obesity or smoking, which are things that might preclude you from making that a good choice for you. So other alternatives may be used, which are progesterone based rather than estrogen based. There's also medications called gonadotropin releasing hormone analogs. So what these do is basically they target the hormone that that controls estrogen. So by reducing the estrogen levels, you're basically shrinking the fibroids, and that's the idea behind that. And then there's surgical options. So I won't go into super details about those because I'm not a surgeon, but I'll just basically highlight what they are really. So you have uterine artery ablation. So what that does is it basically cuts off the blood supply to the fibroids, and by doing that, you're basically starving the fibroids. So just imagine someone starved you of your food, you'd start to shrink. And a fibroid is basically just like that. So if you cut off the blood supply to it, you're cutting off what feeds it, and therefore it starts to shrink. There's a procedure called radio frequency ablation. So that's where they use a probe to basically heat up the fibroid, and again, that causes it to shrink. Endometrial ablation is where they basically use a laser to remove the lining of the inside of the womb to get rid of the fibroids. And there's some more invasive procedures. So you have myomectomies, and that's where they basically cut out part of the womb that contains the fibroid, but it still keeps the fibroid, sorry, it still keeps the womb intact. So that's probably a better option for people who are of childbearing age who still want to have children. And then there's hysterectomies, which is a last resort. This probably wouldn't be something beneficial for someone who's younger and still wants to have children, of course. So this is probably something for someone who's older, or in last case resort where all other treatments have failed. But I think with all of these options that are available, it's something that you'll discuss with your surgeon if it ended up going down that line, and you would have to look at what treatment modality is the most viable for yourself. Yeah, in regards to complications, the complications kind of depend on the size and the position of the fibroid. So there's lots of possible complications. A lot of them are rare, but it's just I'm just going to highlight them to just give an idea of some of the things that could potentially go wrong with fibroids. So in fibroids, there's a risk of preterm labor. Depending on the position of it, it can increase your risk of miscarriages, but again, that's very rare. It can increase your risk of needing a C-section, depending on the position of it. As I mentioned before, there's links to fertility problems. We don't exactly know why it affects your fertility, but one of the theories is regarding the position of the fibroid. So if you imagine the fibroid was, for example, blocking the fallopian tube or the entrance to it, the fertilized egg wouldn't be able to come down the fallopian tube and embed itself in your womb. Or if you had one that was lower down, it could cause a similar type of issue as well. So that's fibroids summed up. So what I'll do finally, I'll go over endometriosis and talk about some of the similar factors regarding it. Adora gave a lovely introduction into the condition, so I will just lead on from there. So endometriosis, as Adora mentioned earlier, is essentially where you get tissue that's normally supposed to be inside of the womb developing outside of the womb. It can end up literally anywhere. It's such a random condition, and that's why it's really hard to diagnose it. It can end up in the bowels, it can end up in your gut, it can end up in your lungs. Very rare, but it's a possibility. So that's why it makes it very difficult to diagnose. It's the second most common gynecological condition after fibroids. And as I mentioned before, because of the variation of where it can, this tissue can end up, it means that the presentation of the condition can vary as well. Again, similar to fibroids, it's hard to say how many people it affects because you get some people who don't get any symptoms at all. So it's hard to say, but it's estimated that it affects about 10% of women of reproductive age. Endometriosis has been found in 30 to 50% of women who have fertility issues. So that gives you an idea of how much it can potentially impact fertility. And also, it's important to know it doesn't just have an impact on your physical health, but it can also have a massive burden on your mental health. It can have a massive burden on your sexual health and your sexual relationships as well. So that's why it's such a problematic condition. That's why it's important for us to talk about it. In regards to the causes, unfortunately, I feel like that's going to be the theme of today. We don't entirely know what causes the condition, but there's lots of different theories or hypotheses in regards to what can potentially be the mechanism of action as to how these things happen. There's a link in family history, so having first degree relatives who've had the condition increases your risk of having it. There's a theory called retrograde menstruation. So basically, if there's obstruction to the outflow of menstrual tissue every month, for example, if some people have had female genital mutilation where the vagina has been closed up, or if they had some structural abnormalities that prevent them from having regular flow, some of that tissue from the womb can track upwards into the fallopian tubes and the wombs and can embed themselves there. So that's one theory that has been suggested. There may be immune issues, so it may be an autoimmune process that's happening where the immune system, which is usually there to fight off infections, attacks its own body and your own sort of healthy tissue. There's a theory about lymphatic spread. So the lymphatic system is basically a collection of glands and vessels that help the immune system do its job, basically. And some of the tissue that's found inside the womb can track through that system. And that's probably a theory that kind of explains how you can get tissue that's supposed to be in your womb ending up somewhere as far as your gut or your lung or wherever, because it kind of spreads through this system. And then finally, metaplasia has been suggested as a possible cause as well. So this is where you get one type of cell that mutates into a different type of cell. So you can have a cell in one type of body that ends up changing into the tissue that you find in your womb normally. So lots of different suggestions and theories as to why this happens. Again, not entirely sure, but these are some of the theories that have been suggested recently. In regards to risk factors, a lot of it, again, is estrogen related. So things like having early onset periods or late menopause or not having children, that's all around increased exposure to estrogen. I saw studies that suggested having late sexual encounter being a risk factor. Not entirely sure why that is, but that's also a factor. And as I mentioned before, anything that causes obstruction to the outflow of, the products of the womb can increase the likelihood of this happening. Although yes, it is possible, it is a condition that affects Black women. Actually, studies are showing that it's actually more prevalent in white women, but it still has a great degree of burden in Black women as well. And other issues like having a low BMI and smoking as well have been implicated in increasing the risk of developing the condition. In regards to symptoms, as mentioned before, it can vary. If you look at the list of the symptoms here, those are the exact same symptoms I listed with fibroids. So it can vary. And another issue with this condition is it can mimic other, it can mimic other benign conditions, and it can mimic other severe conditions. So it really is a difficult one to pin down. And sometimes it can take quite a long time to get to the diagnosis because it can be missed on scans very easily. And that's essentially what I summed up just now. So you're very difficult to differentiate it from other conditions, and very difficult to diagnose. In regards to the modalities used to diagnose it, the first line from a GP would be you doing something like an ultrasound scan. But again, as Adora suggested, this can be easily missed on the ultrasound scan because the amount of endometrial tissue that you have that's being driven by this condition can be very small or could be very large. So it's hard to find on scans sometimes. Sometimes you may have to have a keyhole surgery because that will allow the surgeon to directly see this abnormal tissue outside of the womb. And in that procedure as well, they would usually get rid of the tissue as well, and also using more higher resolution scans like MRI scans give you a bit of a better chance of seeing this abnormal tissue. But again, it can still be missed. So it is difficult. In regards to management, again, it varies. You can do nothing if you're not having any symptoms from the condition. But from a general practice point of view, you may be offered things like simple analgesia, so things like paracetamol or ibuprofen. Again, hormonal treatments can be used to treat the symptoms as well, similar to that offered in fibroids. And then there's surgical options available, so things like keyhole surgery, or sometimes you may have to have open surgery, which is what laparotomy is if keyhole surgery is not the most appropriate option. There's lots of different homeopathic treatment options that have been implicated in the management of the condition, such as acupuncture, reflexology, herbal medicine, etc. The evidence in regards to the benefits is limited, but it's not to say that one is not allowed to try them, because like I said, some people may not want to go down the chemical route or the surgical route or what have you, and may want to try these other alternatives. It's just to highlight that we're not entirely sure statistically what the benefit of them is, but more than welcome to try. As I mentioned before, there's lots of potential complications related to the condition, and again, we don't entirely know why that is. It may be because, just as an example, you can get this abnormal tissue that grows in the fallopian tubes and therefore blocking it. Therefore, the fertilized egg can't come down from the ovaries into the womb, and then thus causing difficulties with fertility. Surgery can be an option in regards to helping treat the condition, but it may not always be successful. And sometimes people may need extra help in the form of things like IVF to help them with conception. Adhesions is a possible side complication as well. So this is where basically when you get this abnormal tissue growing outside of the womb where it's supposed to be, this tissue can be really sticky. So for example, if the tissue, if this abnormal tissue ended up in your bowel, for example, it can cause bits of your bowel to be more sticky. That can be quite irritating and also very painful. And sometimes you may need surgery in order to break that up. And you can also get cysts that can form. So if, for example, if you get this abnormal tissue in your ovaries, that can form large cysts to form, which can also be painful and can also rupture as well. And there's also surgical complications that one needs to think about as well. So common things like pain after procedure, infection, bleeding from the procedure, failure to treat it, and also, you know, even if you have surgery, some of it can still come back again. So that was basically a whistle-stop tour through endometriosis and fibroids. I think probably the key take-home message is, because I don't want to leave you with a doom and gloom message. So like I said, there's some things that are out of your remit to control, such as having a family history of the condition, or the fact that you're Black. That's not something you can change. It's not, I don't think it's something you would want to change. But in regards to lifestyle changes, just like Kandanke summed up very beautifully, there's lots of things in regards to diet and exercise that you can do to help reduce your risk of developing some of these conditions. So I hope that was helpful to you, and thank you for having me.
Oh, fantastic. Thank you so much, Aaron. So informative. And you know, to actually go into the detail and to see on the slides, especially in regards to the different places in which these fibroids, you know, little devils can, you know, start to grow.
Yeah.
So it's just, and it's really good that you spoke about the vitamin D as well. There's a huge drive, especially, you know, in this pandemic, the drive for people to be more healthy and, you know, be aware of getting their vitamin D, being outside for at least, you know, 20 minutes, half an hour to get the sunlight and what little bit of sun we can get at the moment. One of the, I've had a quick look in the chat, and somebody was saying that it took them 19 years to get a diagnosis. That's goodness.
Yeah, like I said, because it's a difficult one, because like I said, a lot of these conditions mimic other. Just an example. So I don't know if everyone's heard of irritable bowel syndrome, which is a very common thing that can happen. You can, those symptoms can mimic the symptoms you get in endometriosis or fibroids, and it's very easy for your doctor to just say, oh, I think you've just got irritable. I'm guilty of that sometimes as well. Because sometimes you just have to see how things go sometimes. So you may mistake it for something like irritable bowel syndrome when actually something more
else going on.
Exactly, something else may be going on. So that's what makes it difficult. But I think it's important to, if your symptoms do persist, go back to your GP and then the most likely to look into it further if things don't settle down. That's usually the way things go.
Yeah, and another thing that I picked up, some about them actually growing back. So do we know sort of like in what percentage of women these actually grow back once they've been removed?
No, again, it's because it varies from person to person. I think the more fibroids you have, the more likely you are to have them grow back. But for people who've had smaller fibroids, one, you wouldn't do anything about them anyway if it's not bothering you, because like I said, even though surgery is an option to treat them, there's so many complications that can happen with these surgeries. So if you have a small fibroid, you wouldn't want to do anything anyway. But yeah, there's definitely a possibility of them growing back if you have a larger number of these fibroids.
These are more like the doctor's ones, which I'm kind of like.
I could get the co-host to mute everybody. Right, so Adora, thank you so much, Aaron. That was excellent. Really, really thorough, informative. So, we've had a biology lesson there and really got into, in depth around, fibroids and endometriosis. So thank you very much for that. And we've got the lovely Adora coming up next. Who's going to talk about polycystic ovaries.
Yeah.
So could you stop sharing, please, Aaron?
Oh, yes.
Thank you, darling.
I told you I was rubbish with computers.
I'm not great myself, but I'll try and see if this works. Sorry. Okay.
Yeah, we're there.
Start from the beginning. Oh. Okay. Great. Thank you. And thank you, Aaron. Very, very, very informative, very concise. So as I said, I am going to be talking, sorry, just 1 second. I've got the image on the side of my screen and I can't get rid of it. Oh. Okay. Sorry, give me a moment.
Just need to enlarge it again.
Yeah. Okay. Can you still see my screen? Oh.
We can see your screen. Just need for you to enlarge it again, my darling.
Okay. Do you know what? I'll just carry on. Sorry, there's something on the top that's not letting me play it, which is annoying. Oh, there we go. Okay, great. So as I said, I am talking about polycystic ovary syndrome. So it's a really common syndrome that affects how women's ovaries work and the balance of hormones in the body itself. It's quite common. We think it affects about 10% of women in the UK, probably closer to in between 10 and 20% actually. And the vast majority have, well, not vast, but the majority of women actually have no symptoms. And for a lot of people, it won't actually, necessarily negatively affect them. However, it is the leading cause of infertility in women, and especially in Black women as well. So if we're talking about the actual main features of PCOS, You have to have 2 out of the 3 to actually get a diagnosis. But the first one is irregular periods. And the reason for that is because your ovaries are essentially not regularly releasing eggs. So you're not ovulating. Ovulation is what triggers the body to release hormones, which, essentially can prepare you to get pregnant if you wish to. If you're not regularly ovulating, then you will end up having irregular periods. And just to be clear on what irregular periods actually are, we have a sort of wider range than people might think. So normal periods is between 21 to 35 days. So and that's between day 1 of the period. So, that means that actual normal periods can be anything from about 3 weeks in between to more like 5 weeks. And you can also get quite heavy periods as well. So that's one of the main features. Another main feature is excess androgen, so high levels of male hormones, specifically testosterone in the body, and that can cause physical signs, which some of you might be aware of. So things like excess facial or body hair, also known as hirsutism. You can also get acne as well. And then finally, actual polycystic ovaries. So funnily enough, if you can see at the top, 2 out of 3 gives you the diagnosis. So you can actually have a diagnosis of polycystic ovary syndrome and not have polycystic ovaries. But if you have the other factors, then you could also have that diagnosis. So hopefully you can see the picture on the side. So essentially a healthy ovary has, normal follicles. You have a developing egg, and then it's released when you ovulate. When you have polycystic ovaries, you have lots and lots of these follicles, which are taking up space. They make the ovary quite large and bulky, and they do not, develop eggs effectively. And therefore that can cause the issues with you ovulating. Now, in terms of the signs and symptoms of PCOS, a lot of them will be similar to what we'd mentioned before. So obviously, you can have irregular or prolonged periods, you can have quite heavy periods, you can have cramping and bloating during periods, and linked to the hormone issues as well. You can have problems with growth of unwanted hair, but then you can actually also have hair loss where you want it. So you're growing chin hairs, but losing hair at the top of your head. And then acne is also an issue as well, but then you have more systemic problems that can be associated with polycystic ovary syndrome. And these often tend to be linked to the imbalance of hormones, specifically, testosterone and androgens and insulin as well. So a lot of people can feel quite fatigued. You can experience quite rapid weight gain and actually find it hard to lose that weight as well. And there's also issues with mental health as well, psychological issues, so stress, depression, etc. And then if you add the pelvic pain on top of that, you have a nice little cocktail of signs and symptoms. So in terms of what causes it, to join with Aaron, I think a lot of these things will be similar in that we don't know the exact causes, but there are lots of causes and lots of things that we hypothesize around. A big thing for PCOS is that it tends to run in families. We're not sure why, but I think similar to fibroids as well, there does tend to be a genetic link. But the main issue that we know is that there's this problem with hormone levels. So essentially what happens, and the main thing that will cause a lot of problems is that you have high insulin levels and your body is resistant to insulin. So insulin is the hormone, just to make it a little bit clearer, insulin is the hormone that helps take the sugar in the body. So if you eat carbs, bread, sweets, whatever, it needs to be broken down and taken into your body cells to give you energy. Insulin is the hormone that helps to do that. Now, what can happen, or what happens in polycystic ovary syndrome, is that you have the insulin present, but the body is resistant to it. So it's not taking up that sugar into the cells to use for energy. And what happens is you have lots of floating insulin and lots of sugar as well in your blood that shouldn't be there. And the problem with having excess sugar in your body and being resistant to insulin is that can affect you in lots of different ways. So first of all, it can cause you to be overweight or obese, because, and that in itself can then, it's a cycle, which I'll show you on the next slide. That itself can also increase the amount of insulin that your body needs. When you're not breaking down blood sugar, when you're not sort of metabolizing your blood sugars appropriately and taking them into the blood cells, you get physical symptoms as well. So common symptoms are that people feel fatigued, they feel really tired, and also you feel hungry, which then makes you eat more, and then the cycle continues. Now, the problem with having excess excess sugar that's not being metabolized in the blood is that puts you at risk of developing health problems later on. So when you're in prolonged periods of insulin resistance, that can lead to type 2 diabetes, which is one of the main risk factors of polycystic ovary syndrome. But in addition, that also leads onto cardiovascular issues as well. So that can also predispose you to high blood pressure and high cholesterol, because it is all sort of more of a balance, and hopefully this makes it a little bit clearer. So if you see at the top, you eat carbs, your body makes insulin, fine. The cells are resistant to that insulin. They're not taking the sugar into the cell. So then that sugar actually is stored as fat, which then leads to the weight gain. Because you're not taking up that sugar into the cells to give you energy. Carbohydrates are really good for energy. They're the body's ideal to use for quick burst energy. Because you're not taking up this sugar into the cells to use for energy, you feel tired, you feel hungry. And then the cycle continues. You eat more carbohydrates to get that quick boost, and then you're making insulin, but nothing's going on. You feel tired and hungry, and the cycle continues. So when it comes to Black women specifically, once again, the research is limited, but we do know that Black women have higher levels of insulin resistance, and we know that Black women have higher rates of obesity, and there's certainly a link between the two. It can be a bit of a chicken or the egg scenario, which one came first, because I don't think there's enough evidence really out there behind PCOS in general, but also, behind the links and things between Black women and other women of color. But we do know that because we have higher rates of obesity, we also have higher levels of insulin resistance, and then both of these can affect fertility and your cardiovascular health. So how can we treat polycystic ovary syndrome? So it really depends on the symptoms that you have. I think it's different to a lot of the other ones or a lot of the other sort of reproductive conditions, in that there can be points where you might not need any treatment entirely. So if I go back just to refresh your memory, if you have any one of these three main features, so if you have irregular periods, if you have problems with excess male hormones, so testosterone, or if you have polycystic ovaries, how they affect you will depend on how we treat things. So if we start off with irregular periods, the main thing that is recommended is the pill, the combined oral contraceptive pill. And the reason for that is because it's sort of a two-pronged approach. So if you have any issues with regular periods or irregular periods, you want to regulate them.
Could I get, sorry.
The podcast, if they're the same.
Very loud.
If they're the same.
Thank you. So if we're talking about the combined pill, the issue with irregular periods, because you might sit and think, well, actually, what's the issue? If any of you have suffered from anti-flow, you'll actually be quite happy to not have a period at all. But the importance of us actually having regular periods, and what we class as regular periods is a minimum of 3 periods in a year, is that it protects the lining of the uterus. The issue with periods and with ovulation and things like that is that when an egg is released, that stimulates that obviously that's ovulation, but that stimulates the breakdown of the lining of the uterus, and you shed it. If that doesn't happen, you don't shed the lining of the uterus, but it keeps proliferating, it keeps growing. And when you have uncontrolled proliferation and growth of the uterus, of the lining of the uterus, that can, put you at risk of endometrial cancer. So that's why it's really important that we are ovulating regularly. And that's why if you do have irregular periods or no periods at all, then the combined pill will help to regulate things in some way and at least, ensure that the lining of the uterus is being shed. In addition, because of the hormones, it's giving some estrogen, it's giving some progesterone. The symptoms that we have with the unopposed male hormones, so with the excess testosterone that causes the issues with hair and things like that, actually also helps for that. So it can help with hair problems, it can help with acne as well. And then on top of that, it's a contraceptive. So that's why we recommend the combined pill for people who have irregular periods. Now, if you have more of the hormone side of things, so let's say you have problems with insulin resistance and weight issues, what will tend to happen is when you're investigated or when your doctor does see you, they similar to before, they might do a scan to see if you have actual polycystic ovaries. They should, if they're going to give you that diagnosis of polycystic ovary syndrome, but they will also do some blood work as well. So if they found out that you are insulin resistant, your blood sugars are elevated for whatever reason, because we know the risk that can give in later life for heart problems and even fertility problems, we normally recommend a medication called metformin. Now, metformin is, you may have heard of it if you are type 2 diabetic or know anybody who suffers from type 2 diabetes. It's licensed to treat type 2 diabetes, and we have to remember it's actually not licensed for treating PCOS itself, but it can be used off-label to treat these sort of side effects. And the reason that we like metformin is because it lowers the insulin levels and the blood sugar levels in women with PCOS. By reducing those levels of circulating sugar, where you're increasing the likelihood of the sugar being taken into the blood cells, and thereby reducing the risk of heart problems and cardiovascular problems in the future, but also helping manage weight as well. If you go back to that cycle that we spoke about earlier. What people don't often know is that there is a link specifically with insulin levels and excess sugar in the blood. And there's a link with that and fertility as well. And that can also reduce the risk of miscarriage, actually. So by controlling the sugar that's in the blood cells and making sure that the insulin levels are lowered, that can also stimulate ovulation. It helps to encourage regular periods, actually, as well as the combined pill. And then that thereby lowers your risk of miscarriage. So how it tends to affect most people, as I mentioned earlier, is with regards to fertility. So I think the important key is that most people will conceive naturally. Obviously, that's not the case for a lot of people, but the vast majority of women will. So it is really important. I think mindset can be really important in these sorts of cases. If you have a diagnosis of PCOS, it doesn't automatically mean that you will struggle to conceive. However, if you do, there are different options that we can try. So what will often be recommended, either by your GP or by your gynecologist or specialist, if you end up needing to see somebody, is a medication called clomiphene. So you normally take it at the beginning of your cycle for a couple of months, and that encourages ovulation. So we already know that the polycystic ovaries, the main issue is that they're bulky, filled with follicles, and we're not ovulating. So taking this medication actually encourages ovulation and hopefully increases the chances of falling pregnant if you wish to do so. If clomiphene doesn't work, metformin can be used as well. As I mentioned, it's not specifically licensed for PCOS, but it can be used off license. to help with fertility. If both of those are not effective, then the next steps tend to be things like hormone injections or IVF treatment. And then in some cases, we also do go on to surgery. So some people will get ovarian drilling done through a keyhole, which is where they actually try and remove some of those follicles and cysts that are affecting your ability to ovulate and produce excess hormones. So that is it from me. I hope that was helpful. Apologies for my issues.
No apologies necessary. Adora, fantastic presentation. Thank you so much. So in depth. I've actually learned a lot, and I didn't realize you need to have two out of the 3 symptoms to be diagnosed. So that's something that I've learned this morning. And weight. I didn't realize that weight was such a big factor in this. You know, so that's what sort of like triggered in me. You know, if anybody has any weight issues, etc., you know, please contact me. Come on the 30-day intermittent fasting challenge, where you'll learn about food. You'll have an eating window, and you will somehow drop the pounds. All of us within the group, we've dropped the pounds. You know, so you know, if anybody wants to come on the King's 30-day intermittent fasting challenge, which is kicking off on the 1st of March, you know, it's a different alternative, I suppose, to going down the medical, taking the drugs, etc. And if you can lose weight naturally to kind of like combat this condition. So yeah, it's very, very, very thought-provoking. And it always, you know, you find with these sessions, it always goes back to the key things. You know, it's about your diet and your lifestyle, isn't it? To combat a lot of these different health conditions that we have in our community. And the link towards the insulin as well. I didn't realize it had such correlation there. So thank you very, very much for that. I just want to remind guests on the platform to hear about, because I know a lot of people are coming in, you know, all now almost an hour later, to hear about future Queen events, Queen Walking Group events. Please follow us on Eventbrite, and please note that this Zoom event is being recorded for release on our YouTube channel. So if you look for Queen's Lockdown 2020 series, this recording will go up onto the channel in a few weeks' time. Okay, thank you so much, Adora. And could I also ask the presenters to please put their contact details into the chat? Somebody was asking Adora about Glowdox, so you could put some details into the chat about that.
I will do.
And people want to get in touch with you there. All right, so swiftly moving on to our next presenter, and we have the fantastic Imani.
Oh, hi there. Hi, everybody.
Hi, welcome to the platform. Welcome.
Great to be here. Great to be here.
Oh,
Thank you for inviting me.
Oh, you're very welcome. So please tell us a little bit about yourself before you kick off.
Okay, well, I'm a qualified holistic health practitioner. I also qualified in acupressure.
Right, you've been muted. So if you unmute yourself, please, darling. Or if Rudy, can you unmute Imani, please? Oh, fantastic. Yeah. So you've started.
Can you hear me now?
Yeah, I can hear you now, but your presentation isn't up yet.
Okay, well, I'm a qualified holistic health practitioner. I'm also specialized in acupressure. I myself found out I had fibroids 15 years ago, and I went on that journey of healing myself to shrink them naturally using holistic strategies. And so my work is, as a fibroid coach, is supporting other women to do the same. And it's not a one-stop shop. It's very personalized. Every woman is different. And so I work with them in a range of ways. But today I'll be more so looking at breath work and energetic work, really, with clients.
Okay, fantastic. Thank you. So I'm eagerly awaiting your fantastic presentation.
Oh, thank you. Well, you know, for me as a practitioner, we look at diets, we look at exercise, we look at herbology, you know, and thank you, Kandake, for such a, you know, great presentation around holistic health. and thank you for the others as well. Fantastic and informative presentations. My approach is very holistic. It's looking at lifestyle changes, really, the things that we have to take on board. First and foremost, in terms of healing ourselves, getting the body back to that natural environment, that nature environment that it does so well in, you know, divine energies. Our creator has given us everything that we need to in terms of healing and keeping the body maintained. However, we're living in an environment, in a society which is quite toxic, actually. And so a lot of my work looks at toxicity and how to eliminate toxins from the body. So, but because of time today, Joan, I'm just going to be focusing on the importance of breath.
Okay,
yeah, and so life is absolutely dependent upon the act of breathing. I thought that was a really important quote to put down, really. We take it so much for granted. Every day we just get up and we start breathing, and we're not really cognizant of what is actually taking place in the body when we are breathing. However, I teach my clients to breathe correctly because of the culture that we're in now, because of lifestyle, because of stress response. Many of us.
Interrupt you, darling. There's a couple of people saying that they can't see, they're not seeing your screen, but I can see it. Can everybody see?
Yeah, it's there.
It's there. I can see it. Okay, sorry. Continue.
It's okay.
Okay.
So I'm looking today at the stress response and how that links to fibroids in terms of toxic overload and estrogen excess. Okay, so not only are we dependent on breath itself, it's critical for our wellness and longevity. However, if we are taking on incorrect breathing patterns, that can actually exacerbate some of our health conditions. So incorrect breathing, and I'll show what incorrect breathing is and what correct breathing is. Incorrect breathing can create painful cycles, painful periods. It can create fatigue, mood swings, but it can also create stagnation in the blood so that the blood flow during our menses is very irregular or very clotted and heavy. The quality of the blood, for instance, it can darken the blood as well, rather than that rich blood flow that we're meant to be getting. So incorrect breathing can lead to toxic overload, and that's where it can contribute to estrogen excess, which could then lead to fibroids. So yes, you know, something else that a lot of women with fibroids will experience is that overcalcification of their fibroids. That's where the fibroid can get very hard. You know, I don't know if people can testify for that. If you have fibroids, that, you know, when you feel your tummy, it's quite hardened. And that's because the fibroids can grow quite fast. And there's a lot of research to show that for Black women, the accelerated rate of fibroids growing is often quite higher. And we need to look at why that is. So when the fibroids are growing, they can outgrow their own blood supply, and that can result in a process called degeneration, called hyaline degeneration. And this degeneration can encourage an overproduction of calcium. Yeah. Now, it's wonderful in one way. The body is creating this overproduction of calcium to protect the body, to protect the major organs. However, an excess of calcium is not a good thing, but that calcium shell is forming around the fibroid mass to protect and buffer. But as a result of this mass getting hard, it can create a great deal of pain and discomfort for women with fibroids, but also it can actually start to make it quite difficult to then to shrink naturally. Yeah, so that often leads to women making other decisions around, you know, cutting them out and so on. So we have to look at the fact that the mass of the fibroid can dissolve. And that's what I work with women on, around the dissolving of those masses using herbology and so on. So it's during this calcification process and phase that the fibroid tends to be the most prominent. That's when we tend to feel it and detect it, and then we go for an ultrasound or ultrascan to check it out. However, my key thing is calcification is telling us that there's a pattern of excess here. There's something excessive going on in the body. And many of the other practitioners have spoken about the liver being a critical organ in terms of its role of detoxification. So in some way, it alerts me that the liver of a client might be sluggish. It's not doing its job as effectively. The detoxification process might be obstructed or hindered in some way, and the body's not able to shed the excess calcium that it's being retained and stored, and also the excess estrogen that is building up as well. So one of the first things that I look at with women is detoxification. We look at diet. We look at the quality of air that they're taking in and whether or not they're breathing correctly. We look at their attitude to life challenges, because a lot of trauma gets stored in the body, as we know. And I'm not just talking about now, I'm talking about historically and genetically as well. The cells have a memory. And so how do we work through these things to actually make sure that we're not suppressing any toxins through trauma? So correct breathing, as opposed to incorrect breathing. Now, in terms of correct breathing, that's when we are breathing through the nostrils, not the mouth. Many people are suffering with asthma and so on. A lot of that could have stemmed from the incorrect breathing as a child, where they're breathing through the mouth. The wonderful thing about the nostrils is that it has its own filtration system. It has the hairs of the lining that allows the air to be filtered and warmed up before it reaches the lungs. It's particularly important now during this COVID as well. And the fact that we're breathing through the nose will increase the vitality of our health and start to help us to reduce symptoms such as asthma and respiratory problems. So the first thing is really breathing through the nostrils. The second thing is reducing the breathing from the upper chest. When we breathe from the upper chest, we're not taking in as much oxygen. We're not taking the body through the calming down of the nervous system. And we can only do that by applying lower abdominal breathing as opposed to chest breathing, because as soon as we apply lower abdominal breathing, the vagus nerve in the diaphragmatic area of the lower stomach starts to get activated, and that has a direct correlation with the hypothalamus and the brain. It's telling the brain to relax. So when we're not breathing in that way, we're always in a fight and flight situation. We're always responding from the upper chest, very shallow, very short breath. And that is leading to a lot of anxiety, emotional tensions, and so on. So many of the GPs that I work with, in fact, 50% more increase during the COVID and lockdown of mental health challenges due to anxiety and worry at this time. And people are referring clients to me because of the breathing techniques that I do. So this lower abdominal breathing, and we're going to go through a very short practical in a while, helps to look at emotional balancing. It balances out the nervous system. It actually keeps our hormones balanced. Many of us, we spoke a lot about the hormone imbalance that could lead to unwellness. It increases our mental capacity, our mental power, but also there's a sense of calm, a sense of harmony, self-control, and clear-sightedness as a result of breathing in this way. And the reason why this relates to fibroids is that there's a direct correlation between the lungs and our blood. Unless we are really getting fresh air in sufficient quantities, and that fresh air reaches the lungs fully and effectively, then there's a foul stream of toxins in the venous blood that cannot get purified, and subsequently that could rob the body of nourishment, and in fact what ends up happening is that gets recirculated around the body rather than being expelled, and that can lead to toxicity. So the impact of incorrect breathing is that only a shallow portion of the lung cells are brought into play. you know, so the greater portion of the lung capacity is lost. And if our respiratory system suffers this type of under-oxygenation, then it will impact on the quality of our blood and also the blood flow. And this can lead to toxicity, which can then contribute to fibroids. And I say contribute because, as many of the speakers said, it's not one thing. We have to look at fibroids as being a symptom of something greater. You know, it's telling us that the body is not in balance. You know, there's an excess issue going on, and that could be due to a range of contributory factors. This is, you know, a picture of someone recently, a client who came to me after having her fibroids out, actually. She had 11 fibroids, and she didn't want them to return, you know. So she had a myomectomy, but she didn't want them to return. So she sent me the picture just to share the fact that these things usually stem from toxicity, and toxicity can come from stress also. It's not just about diet, it's not just about the exotoxins in the products that we're using, which has harmful chemicals. It's not just about our lack of exercise and so on. There's a host of contributory factors. So in order to cure ourselves, we have to look at a holistic lifestyle change. So what I'm going to do now is, you know, explain to you about chi and energy in its first place, really. This is something that we can't see, but it has a massive impact on our lives, our living, and our health. And this energy is all around us. And yes, we breathe it in, and we can also get energy and chi through live foods. You know, when we eat a majority live raw diet, that brings us into contact with a lot more energy into our body system. So live diets, raw diets, as much green cruciferous vegetables, a lot more fruit, you know, actually aids in our health and well-being in terms of eliminating and helping to shrink fibroids. But energy mainly comes through our body, through our breath, you know. So going out every day just for a walk to breathe in, you know, I mean, I'm not saying it's the greatest air, but it's all that we have right now. And, you know, to breathe in rich, full air is really critical at this time, especially where many of you might be working in situations where you have to wear the masks and so on. You know, the nose and the mouth were designed to take in oxygen. So when it becomes strained and inhibited in this way, it can actually lead to long-term illnesses escalating. You know, the carbon dioxide is the vehicle that allows the organ systems to eliminate waste. So when this process is obstructed and restrained in some way, especially now as we're wearing masks, it can put a lot of strain on the heart and lungs. And what we're finding is the blood quality of women's cycles is actually changing as a result of that, because they're finding that they're not able to eliminate the toxin through correct breathing, and it's leading to creating an acidic environment instead of a balanced pH environment. So it's really important, and I emphasize it, and it's free of charge. Go out there and take that walk and breathe in, you know, that air, and really strengthen the lungs. It's quite critical, not only for respiratory health, but overall health and fibroid health. Okay, so when we're taking in this oxygen, we're also taking in chi, energy, okay? And the traditional Chinese medics also have another system called the meridian channels, you know, another system where energy flows through our body and it goes directly to each of our organs. So there are certain meridian channels that link to the lungs and link to the liver and link to the kidneys, that if we are not bringing in enough chi energy, those meridian channels can get blocked and stagnated, which could lead to clotting blood, heavy cycles, irregular flow of cycles, etc. So I teach women exercises to improve and enhance their quality of energy that they bring into their body system through diet and also through womb exercises. and energy balancing exercises, but also breath work. So what we're going to do is we're going to just do a very short exercise, a practical, where I'm going to just ask you to sit upright in your chair and just relax, your back straight, but nice and relaxed. And what I want you to do is concentrate on breathing into the count of 4 with your lower abdominal, just below your belly button, pushing outwards. So as you breathe in, I want you to push out your lower abdomen. And then I want you to breathe out, and I want you to draw in and pull in your lower abdomen. Okay, so as you're breathing in to the count of 4, you're pushing out your lower abdomen. And then you're breathing out. You're pulling in your lower abdomen. So you're breathing in, pushing out your lower abdomen, and breathing out, pulling in your lower abdomen. Breathing in, pushing out your lower abdomen, and breathing out, pulling your lower abdomen in. You're breathing in, pushing your lower abdomen out. You're breathing out, pulling your lower abdomen in. You're breathing in, and you're breathing out, pulling your lower abdomen in. And what this actually does, you can keep breathing like that as I'm talking, is that it attaches the vagus nerve, the diaphragmatic center, to the spinal column, to the brain, and starts to create that sense of inner peace and calm and harmony. Because it tells the hypothalamus to cut out the fight-flight mechanism and allow to create those happy hormones, you know, the dopamine, the serotonin starts to flood your body system naturally. So you're in control of stimulating these hormones just by working towards creating more calm and relaxation in our day-to-day, because we are one of the most busy people around the world, and it's really important that, you know, we stay well. I mean, obviously, if I was working with a client, I would do a whole range of different breath work activities. There's different breath work to cleanse the body. There's different breath work to energize the body. There's breath work to detoxify, and so on. So really, it's about creating an environment of peace, which is nature itself. You know, nature vibrates at a certain frequency. And so when we can get our body and mind to align itself with that vibratory frequency, the healing can begin. Because if we're not creating that environment and we're using a host of other things and diet and so on, it's still not going to be as effective, as efficient as if we were creating a balanced environment and then doing that work around diet and exercise and so on. You know, it's like putting a fish, you know, a fish that's unwell, putting it into a toxic stream, you know, it's not going to get well. But if we put it into an environment that reflects, you know, peace, nature, harmony, then it will start to be able to heal itself. So for those who want to get in touch in terms of fibroid coaching or life coaching, but specifically I work with Black women around fibroid coaching, looking at a very holistic approach to healing and how to shrink the fibroids naturally, they can get in touch with me here. I've walked that journey myself, so I think that's quite important sometimes to know, yes, you know, what things have worked and what things haven't, but it's very important that we understand that healing is very person-centered. You know, we have to look at the whole person in order to know then what's going to work for them. And I also signpost to herbologists and so on to look at fibroid shrinking formulas as well. And it's been really amazing. There was a woman who, I mean, I didn't, I'm kind of being very graphic here, but sometimes women share the actual images of the fibroids dissolving and coming out, you know, which is an amazing, liberating thing. And it makes people want to obviously get motivated to do more to heal themselves, because yes, it formed through an unnatural environment of overtoxicity, and therefore we have to have the confidence that you know, in most cases we can actually reduce and shrink them, and actually sometimes fully eliminate them. But we also have to appreciate that conventional medicine is also important. It has its place. And I would just say that is not the first go-to place, because we're always about self-care first, you know, teaching people to heal themselves first and foremost. So thank you for listening. I have created these posters with some GPs in Suffolk, where I live, which are sold to the practices, because sometimes people want something tangible to go away with, in terms of they might be anxious about what might be the signs of fibroids. You know, I have a checking system of some of the things that could be contributory factors that they can check for, but also there's a guide as well if they do have fibroids, some of the things that we really have to get in place in our lives to help the body to heal itself. So if anyone wants those. And I will be lecturing very soon with Noir Wellness with Candice Bryan, and there's going to be a massive fibroids launch. So if anyone is interested in that, they can contact Candice as well. I can send this to Joan to send out to everyone. So thank you everyone for listening. I know it was quite short, but you know, hopefully I'll get to talk longer next time.
Thank you very much for that, Imani. And, you know, if you could please put the contact details, the information into the chat, because I'm sure the chat is actually going to be blowing up now, wanting to get the information from you. So thank you very much for that. Lifestyle change is key. We talk about that almost every week. It's a salient theme that comes up almost every week. Lifestyle changes, healing the body. And that is a concept that we really need to embrace now. And correct breathing, I like that. Holistic lifestyle change, the chai energy. So hopefully when we do the retreat, maybe we can pull in some bits and pieces from you for that. And ways in which, you know, I didn't even realize by these particular breathing techniques, you can, you know, cleanse, detoxify, etc. the body. So that's fascinating stuff. Thank you once again for an amazing, brilliant presentation. And you're going to stick around for the Q&A at the end, and we've got loads of questions, excuse me, coming into the chat. So let's move on to our last presenter, Valerie Mckenn, founder of Womb Health and Wise Health. Are you ready for us, my darling? We're ready for you. We're ready for you.
Yes, oh yes. Yes, last but not least, and I've got an easy job to do because everybody else has covered everything, so I've got the easy job. Now, I just wanted to start off with a little bit of trivia, actually, probably more of a do you know.
You're going to please about yourself. Tell us a bit.
Oh, right, yes, okay, yes. So let me share. Can I share?
Because you've been on quite a journey with fibroids, etc. So
yeah. So when it comes to sharing my screen, hold on a minute. Let me just do this. Oh no.
And you might need to adjust your laptop a bit because I can see it to the top of your head here.
Oh right.
That's it.
Oh, let me just sit back. Let me just sit back.
Relax. We got you.
Hold on. Let me just.
That's it. So it's
Can
coming.
you see that?
Yeah, we can see it now.
Right, okay. All right, so a little bit about me. So this is me. So my name's Valerie. I'm the founder of Woman Wise Health, which is a natural healing practice specifically formulated, well, it was brought about by my own suffering with fibroids and seriously heavy bleeding. So I'm a nutritional therapist, a vegan nutritionist, detox specialist, raw food chef and teacher. I'm an avid fibroid researcher, dedicated yogi, and I was diagnosed myself with fibroids in 2002. I have also had 2 surgeries, specifically after the first one, my fibroids started growing back. So for me, it was after I found myself in hospital in 2017 with severe anemia. I thought, okay, enough's enough. I really had reached my enough point by that time. So this is what I do. I dedicated my life to it since 2017, doing a lot of research around this and mostly trying to find out the reasons why it was Black women who were mostly affected by this. I mean, it's a global issue and it affects all women, but specifically for Black women were adversely affected or disproportionately affected. And I really needed to understand why that was. But before I get going, I wanted to do a did you know? So did you know when it comes to fibroids, you should be, especially when it comes to the monthly cycle, you should be wearing nothing more than a panty liner. If you're wearing essentially what I call a nappy, which is a super plus pad, then obviously that's a sign that something's wrong. As has already been covered, fibroids or any kind of abnormal bleeding is a sign that the body's not happy. So I'm not going to go too much in about the problem because that's already been covered. So we already know what the problem is, but what we really need to understand is why fibroids develop. Now, this was taken from the NHS website, so where they say the exact cause of fibroids is unknown, and you'll see this pretty much anywhere. So the medical industry always says that they don't know what causes fibroids and that there's no proven measures that you can take to prevent the fibroids from developing. But so what they'll do is that they'll end up treating it. Obviously, as already said, there's medicine has its place. But medication and surgery has been proven time and time again not to be effective. What it does is actually suppresses symptoms, and that's okay if you're in pain and you just need something quick. But at the end of the day, it's all about holistic healing. So when we look a bit further into the studies in regards to fibroids, this study specifically, as you can see, it's from the PubMed. So this study is called the Epidemiology of Uterine Fibroids, a systematic review. This one's from 2017. So epidemiology is the study and analysis of health and disease patterns in certain populations. So if you have a look at the conclusion there, you can see what they say. So we identified 12 risk factors, some of them which has already been covered, that play an important role in uterine fibroid epidemiology. The uterine fibroid risk factor with the strongest evidence is Black race. Oh, okay, we're Black. That's it. That's your risk factor. And I thought, okay, if that's the case, then why is that? But it's the why I was trying to find out. Again, we've already covered the risk factors. And one of the things that comes up over and over again is the black race, obesity, vitamin D deficiency, and all those good things. If you look at, there's a study that's done by the government, which is called the Health Disparity Audit. And that will show you, that will give you, like, by ethnicity, the factors that affect certain populations, whether it's regard to mental health, physical health, housing, things like that. It goes on to, it lists all of them. And when it comes to health, especially mental health, things like that, Black people are always at the top of that metric, and not necessarily in a good way either. So my goal was to clarify, or try and do my best to find out what that was. And so with the digging and the digging and the digging, I came up with 3 main factors. These were coming up time and time again, which is toxicity, poor diet, and stress. And no, this is no matter where I've researched, it comes back to these things time and time again. And we've already covered it. My job's been made very easy. And so the fact that the fibroids are worse in Black women is simply because, again, because of all the research I've done. And like we say, if we go backwards, a lot of people say we don't know, but I've looked at this because I've studied, and I've also looked at books by Joseph Dash and other well-known Black holistic health teachers, and it comes down to biochemistry. So I just want to quickly touch on this. Now, don't be alarmed by this, but this is the one fundamental thing that I've learned about healing when it comes to the human body. So you can see clearly from this chart here, this graphic, that shows the biological differences between women who are eumelanin dominant, which is on your left, and compared to women who are pheomelanin dominant. Look at the different pathways. You can see they are clearly different. Pheomelanin is the red-yellow pigment and is nitrogen and sulfur based, whilst eumelanin is the brown-black pigment, and that relies on selenium. So there's a fundamental difference there. So when you have any kind of test, all the reference ranges, and there's our studies that are out there that show this, they are based on pheomelanin. So any treatment you get, any medication you get, will be based on pheomelanin. Okay, so that would suggest we are not doing things that are suited to our biochemistry. I'm not a biochemist in any way, but this is what I found out. So if you're not doing the things specifically for your biochemistry, which is eumelanin, okay, you'll be doing things, using things, and consuming things, and that are not compatible with your uniqueness. So when it comes to, in terms of the world we live in what I've realized, especially over the last year, is that we live in a very, very abnormal world. Nothing is what it seems. So when it comes to toxicity, there's hundreds upon thousands of toxins that are pumped out on a daily basis, added to our foods as well, added to the skincare products we use and all the other products we use, household products, for instance. So we know there's toxicity absolutely everywhere. We cannot escape them, unfortunately, unless we go and live in a bubble somewhere. And so when we take in these products, we're taking in them through our skin, our hair, through our digestive, the air we breathe, the food we eat, etc. So so you've got external and internal toxins. Okay, so like I said, they're pollution, and it comes in two forms. So you've got the exotoxins, which are your external toxins, and then you've got your endotoxins, which are your internal toxins, which is naturally produced by the body by its very processes, you know, that it carries out on a daily basis. So a toxin is described as any compound that has a detrimental impact on cells or cell structure. So it can be man-made, like I said, with air pollution, skincare products, even sanitary ware as well, medication, and like I said already, the generation of natural body functions. So what toxins tend to do is that they can cause mutations of the cell. So fibroids are tumours where the cells have mutated. So, but what you need to know is what's causing that mutation. Over time, what tends to happen, especially with external chemicals, is that these build up in the body over time. So I've often heard that these certain particles or toxicity in small amounts won't cause any damage, but what they don't say is that these actually accumulate in the body. So this is an example of a scan of one of my clients. That was last July. So this is a human toxicity analysis report card. And I see this a lot, and you can see you've got electromagnetic radiation as a toxic pesticide residue. Now, of course, with 5G, that'll probably hit red at some point. So out of all the scans that I've done since last year, the human toxicity, this particular report is consistent pretty much with everyone. And the toxic pesticides residue, that could be from the food you're eating or just something that's in the atmosphere as well. Another assessment that I do is called the 5 toxicity questionnaire. So this was done last September on a client. So as you'll see here, her status for heavy metals, chemical toxicity, gastrointestinal toxicity, liver toxicity, and we've touched on that, and mycological toxicity has been assessed and scored. And the mycological toxicity, if you're wondering what that is, includes molds, fungus, viruses, bacteria, worms, essentially living pathogens. And this is what's not being assessed when you go for a test or have a scan of an MRI scan, ultrasound, when you're or when you're having anything assessed in terms of that, or the heavy periods, the heavy clotty, painful periods. The higher these scores are, the more symptoms you're going to have. So the scores here are generally moderate, but so that suggests that this person needs detoxifying. Now, as a detoxification specialist, and I know sometimes detoxification is poo-pooed, but detoxification is nothing more than you giving your body a break. All you're doing is that you're putting foods and herbs in the body that's going to help support what the body does all day, every day, particularly at night, which is why sleep is fundamental. If you don't sleep, you're not going to be clearing the body properly. And one thing you don't want to be doing when it comes to this questionnaire is moving into the severe category, because that's when your symptoms will be escalated. Again, it's the cramping, the bloating, the heavy gushing. Okay, so this is what I mean by underlying causes. So when we're looking at the underlying causes, these are the kind of things that we're talking about. And another thing that's been touched upon is stress and the disease. Then there's loads of studies out there on this, and this is just one of them. So from this published report, there's a quote that says, "It's clear that such psychological stresses can lead to the alterations of internal functions down to the biochemical level." That's in this report. And that they are potential causes of disease. That's this published study right here that says that. And this is something this has been my own personal journey as well. In order to heal, you need to be mentally, emotionally, and physically ready. And I find that a lot of women are physically ready, but not necessarily mentally and emotionally ready. And that is key. So the first main cause of fibroids, however, is your hormonal imbalances. So whilst we looked at toxicity, we looked at stress, and we looked at diet, these all cause hormonal imbalances. But the number one catalyst is stress. So, and there are plenty of clinical studies, as it says, that document the impact stress has on human beings. But stress is a biochemical disruptor. It really is, because this was already covered in terms of stress, that it triggers the production of cortisol, and cortisol is a stress hormone, and it's released into the body as a way of giving you energy as a boost, so that you can overcome the stress that that's whatever that's stressing you out. So like in normal circumstances, that's not an issue, but when it becomes dysregulated, it will have an impact on your health. And again, we've already covered it, but it does cause blood sugar imbalances. The blood sugar balances leads to increased inflammation, which in turn puts stress on the adrenal glands. This thing then gets dumped into the brain, disrupting the pituitary gland's communication with the womb. Okay, so another study. So earlier I mentioned the 3 factors that contribute to the growth of fibroids. So also what does not help is an impaired and sluggish liver. Again, so you see how this all correlates now, and you've got poor gut health as well in terms of that, because the body functions as a whole, not just one as the sum of its parts. So alongside chronic inflammation, estrogen dominance, and the disruption with the endocrine gland, all these factors contribute to the formation and growth of fibroids. So it's believed that fibroids, estrogen promotes growth by upregulating the inflammatory markers called cytokines. But estrogen is not a bad thing. Because it's a hormone that plays a really big role in both men and women, but we do not need excessive amounts. But there's another thing that I've also looked at, which is called aromatase. So there's research to show that in androgens, i.e. the male hormones like testosterone and DHEA, are converted into an enzyme called aromatase. So aromatase is particularly pronounced in Black women. So in this study, you've got the conclusion states that leionoma tissues from African American women contained the highest level of aromatase expression, which may result in elevated tissue concentrations of estrogen and account for the higher prevalence of earlier incidents. So aromatase, where it tends to be found, is in the adrenal glands, the ovaries, the placenta, testicles in men, brain and fat tissue. And high levels of this enzymes convert testosterone and progesterone into estrogen, causing hormonal imbalances, otherwise known as estrogen dominance. So if the estrogen, if the underlying causes are estrogen dominance, inflammation, high aromatase expression, all caused by poor diet, stress, and toxicity, then all we have to do is tidy up our diet, de-stress, detox, and that will reduce the toxicity. Easy, right? So when it comes to treatment options in the natural realm, let me just say this from the start in terms of you can't just take a few herbs and a few supplements and expect the fibroids to melt away or drop out. I wish. So it depends on the size of the fibroids. It's going to take consistency and dedication. The fix is simple, but it's not quick. So this is easy, but I find that just a clean diet, hydration, sleep, and de-stressing for most people, that's a struggle. It's that looks easy. It's just 4 things, but for so many people, it's a big struggle, because I speak to so many women who want to shrink, eliminate, obliterate, blast out the fibroids, and honestly, I cannot blame them. But if I always say to women who just go, right, if I take this, can I shrink the fibroids? I say, if you want to get rid of them quick, especially if they're big and you've got multiple, just have surgery, just have them removed. Not the womb, just have the fibroids removed. But so natural healing, it does work because I've done it myself, but it takes a lot longer than you think, and depending on what you do and how fast you do it. The body is more than capable of healing, and we just really do not appreciate what the body is capable of. But you have to give it a chance and be patient, because there's plenty of women, and I can tell you now because I've spoken to hundreds of women that have gone down the natural route and given up because they either haven't got results or because it's not working quick enough. So I'm going to give you eight steps to healing fibroids. So this is quite simple. So it's just 8 things: raw fruit, greens and veggies. So those of you who've been doing your intermittent fasting with the Queens, then you may have been eating more raw fruits and vegetables, especially when we're coming into springtime, where the focus is on the liver, because liver is the wood element, and that relates to spring. The wood element relates to spring. So that's the time to really get going and start cleaning up the liver. So if you want to truly cleanse and heal your body, remove the heavy bleeding and start melting away fibroids, which will take time, a change of diet is crucial. But again, it's very hard for some because we are addicted to the foods that are contributing to the growth of these fibroids and causing heavy bleeding as well. Because certain fruit and vegetables, why I bang on about it, is because they contain certain compounds that reduce inflammation and are natural aromatase inhibitors, okay, such as chamomile, celery, parsley, which is why you'll get some people say drink celery juice every day. So the next one is water, hydration and minerals. The human body is 70% water. So water is going to just help you flush out those toxins. It's gonna, and many health conditions, in fact, can be eliminated just by upping your water intake, especially if you suffer from migraines and headaches. Sometimes it just might be due to dehydration. So you can try lemon, ginger, cayenne pepper. These are all lovely, warming, cleansing herbs and spices that will gently begin cleansing the body. So the next one is to eliminate synthetic estrogens, and you can do that with herbs. Avoid hormone meat and dairy products, soya products, and you might want to replace all your beauty care and personal care products with natural products, and where possible avoid plastics, even though that's really difficult. Again, detox. I always say it's best to have a detox, clear the body of everything, of all the toxicity. It's impossible, so that's why you need just to support the organs of detoxification, because you need to be doing that all the time anyway. And it's safe to say that anybody with a cyst or any kind of tumor, you need to cleanse. So as you remove the toxic load from the body will begin to naturally remove the growth as well, because it's now got those channels of elimination that are more open, so the body can move things through. So I find that a detox is the most crucial step in healing, simply because you're essentially spring cleaning your body from the inside out. So when it comes to the number 5 is to balance hormones, good quality herbs. You'll take these herbs ongoing due to the constant exposure of external estrogens, and you'll need a herbal prescription that will need to be checked every 3 to 4 months, and our sister Daki can certainly help with that. So when it comes to moving your body, we were designed as with the human form is designed to move. We are not designed to sit here idle all day, every day, which is what some of us do, especially if we're working from home. And it's one of the best preventions when it comes to health issues. Because you're going to be moving your body, you're moving your blood, and you're moving your lymph system, and it keeps that from getting stagnant. Cysts, fibroids, tumors, and all that are all the result of stagnation in the body. So simple things like yoga, which is one of my favorite, because that's like a moving meditation, power yoga especially, but you've got Pilates, stretching, gentle things like walking, or even just a gentle jog around the park or something. Dealing with stress, we've been through that, so I won't go too much into that. And another, exercise is also a great form of release when it comes to stress. And of course, check your vitamin D levels. Now, sunshine is probably one of the best. The darker your skin, the more sunshine we need, because I know there are Black people who are out there who go, oh, I don't like the sun, it's too hot, it's too hot. It's like, what are we, vampires? We only come out at night? I don't think so. So we need to, when the sun comes out, if you've got a clean, I wouldn't say toxin free because that's impossible, but if you've got a cleanish body, because that's all we can do, then the chances of you getting sunburn are lessened. Because I wouldn't say use sun lotions, because they're full of toxicity, and you've already got a natural barrier. It's not even a barrier. Our skin is designed to take in UV rays and then convert the sun's energy into vitamin D, as long as you've got the liver working, you've got the thyroid working, the whole endocrine system is functioning. If it isn't, then yes, you will end up with burning, etc. So those are my 8 steps to healing fibroid cysts and tumours. I've got a Facebook group on called Womb Wellness Warriors, where I give hints, tips, and suggestions. I also do one-to-ones. I am looking to do sort of like more longer length courses just to break down these things, because it is fundamental to our well-being that we actually just focus more on our health and well-being now. So that's me done, and thank you for listening. I hope I haven't bored you too much.
No, very, very, very informative. Thank you very much for that. And detoxification, I've made a few notes as always. I didn't. Are there many of you around detoxification specialists? Can you hear me?
Are you speaking to the rest of
Yes,
them?
I'm speaking to you, my darling.
Oh yeah, sorry, what did you say? What was your question?
So I was saying, are there many of you around detoxification specialists? That's a short answer because we're running so behind.
I don't know. I'm sure there's a. So you want just to know more about what it is?
No, I was asking if there's lots of you around. I've never heard of a.
I know there's that. I know of some who are, but most of them are US based.
Oh, right. Okay. Oh, that's interesting. So I'll put on my list. Sleep is, and I admit I don't get enough sleep, so I'm going to really make an effort because it's one of the salient themes again that come through each of our forums. And that natural healing, and like the power, people don't realize, like you say, that how powerful our bodies are, constantly adjusting and readjusting, hormones, etc. So it's really important, the same way in which we go out and we buy expensive clothes, we'll spend heaps of money on our hair and other stuff. We should treat our bodies the same way. So I think he's muted you. I better move on. I'm going to get myself into trouble. So we're going to go across to Nadia, my darling Nadia, who has been monitoring the chat. We can pick up a couple of questions.
Yes. Okay. We have got right. Right. So we've got how do these problems affect a few questions about contraception. And whether that is part of the problem.
Okay, so who would like to pick that up? Aaron, is that one for you?
Yeah. So with contraception, if you look at combined the combined pill, that does contain estrogen in it. But it also contains progesterone in it, which is the whole reason why you have two, because when you have unopposed estrogen running around your body, it can lead to a whole list of problems, like things like fibroids and cancer, what have you. So it contains that other hormone in there to reduce the risk of that happening. And a lot of the other hormones, like the other contraceptives that you have, are all progesterone based. So those don't drive this estrogen problem. So basically, I'm going a long way around answering the question, but essentially they don't particularly increase your risk of getting those conditions per se. Ideally, the aim is to reduce your estrogen exposure with those options.
Okay, thank you for that. Next question, Nadia.
Do fibroids shrink during menopause? Do they actually shrink? I've got 6, and they told me that it weighed 3 kilos.
All right. And Dora, would you like to pick that up?
They should shrink. They do shrink for the vast majority of people, just because if you think about what happens in menopause, you're not ovulating, so your levels of estrogen in the body drastically drop, and that's usually what is feeding the growth of the fibroids, to say the least. So they should shrink, but it really just depends on you, how many you have, how large they are. If you've got, I don't know, 10 huge ones, they might shrink, but they'll still be physically present, if that makes sense. And that's why for a lot of women, surgical management might be recommended. If they don't shrink enough and they're still causing you a lot of discomfort, then if you're no longer getting benefit from estrogen from the ovaries, then they might just recommend removing the uterus in general.
Is there a holistic alternative to the IUS, Meridian coil?
All right, Kandaki, are you on the platform still, my darling?
I am. Can you hear me?
Yep, can hear you.
Well, because of how the coil works, obviously it fits right there in the womb to stop, the egg actually implanting. So the idea is to stop the egg going into the womb. Hear this, my sisters. use the rhythm method, or use, if not even rhythm method, use abstination. So you control yourself. So that is a real way. You know, when I was in the hills with Rastafari many years ago, one of the things that, and it really was a control. There are certain times within our women's cycle, and that's how I first really got to know my cycle so well, is that, you know, I could tell it exactly to the minute it was going to come. And what happens is there's certain times when you ovulate, and obviously to not have children, you do not get intimate within that time. But what does that require? It requires self-control. Now, that is also a part of holistic health, because this emotion, this sexual drive, it get Nofa in a lot of trouble. It's the truth. And that's the one, it's just like the addiction of sugar. It's the one that is very challenging to be able to manage. So that is also part of holistic management. That is a reality, and people do use that as a mean to control. So that actually, I would put that as a real alternative in terms of if you want to control, you know, having children. I'm going to put that one out there. Yeah.
Nadia, next question. Thank you very much for that, my darling.
Yes. What does a shorter menstrual cycle indicate? Then it says 18 days to 24. Sometimes I'm having 2 periods a month.
I think I touched on that earlier, didn't I, with the irregular periods. So 24 days is normal. I think you have to make sure you're counting correctly. So we count day 1 of a cycle as the first day that you start to bleed. So that 21 or 31 days or whatever is between the first day you started to bleed on this period and then the next, and the same on the next cycle. So 21 is the lower end of normal. So if you're saying 18 to 24, a lot of them might be normal. I think with periods, it's really, you know, a big part of it is knowing your body, but often things will fluctuate and change according to what's going on around you, whether it's stress, whether it's weight loss or weight gain. Emotions have a big part to play in why the length of periods might fluctuate. 18 days is on the shorter side, but I think if you, what most doctors will do is, you know, sit down and look at all of your periods over a long period of time. So they'll say, okay, in the last year, exactly how many periods have you had? And then when you actually average it, you might find out that it's within normal limits. So I'd just say, maybe if you're concerned that they're shorter than normal, create a diary and just write down the exact time, you know, each period started, how long it was for, when it stopped, and then take that to your doctor. They'll more than likely calculate an average, and it might be normal.
Lovely. Thank you very much for that. One more.
Okay. Does the polycystic ovary, or I can't pronounce them properly, syndrome continue into and after menopause?
Yes.
It does. Okay. That was straight. And that's, you know, if that was the last one.
One more. One more. That was a nice short answer. One more.
Yeah, that was it, wasn't it?
It will. So if I can expand on it, if that helps. So yes, it does continue, but as you know, going back to what the 3 main things are, the hormone abnormalities, they will not necessarily change. So the big issue with polycystic ovary syndrome is the insulin resistance. That doesn't make a difference, you know, when you go through the menopause. So if that is primarily the factors and the side effects that you're experiencing, then it will continue after the menopause. But if it's more polycystic ovaries, less so.
Right.
One more, Nadia.
Okay, yeah. So when you're highly deficient in vitamin D, does this sort of contribute a lot? Because you've got people in the tropical countries that still have a incident with, say, fibroids. So what does that play? How does that play with the balance of?
Yeah. So the problem is, because with fibroids, it's most like, again, like I said, we don't fully have the answer, but it's most likely a multifactorial condition. So yes, vitamin D deficiency can play a role, because vitamin D plays a role in immune modulation or regulating your immune system. So even though, let's say in warmer climates, you're getting a sufficient amount of vitamin D, there may be other factors that might play a role which can still drive the process that causes fibroids happen in the still. So for example, like we mentioned, well, obesity is still an issue. There's an issue with family history. So all of those factors, despite you having enough vitamin D, are still going to be factors that are still going to lead to the fibroids happening.
Fantastic.
That's it for me then.
That's it. Right, I'm going to open up the platform. If anybody would like to ask a question to any of our guests, to our panelists, this is an opportunity to do so. If you could put your hand up in the chat, put your camera on, so because we don't like talking to a black screen, and just say who you are and where you're calling in from. So we'll take probably 2 or 3 questions. If anybody wants to put their hand up to ask a direct question to any of our panelists, that will be fantastic. So let's see if anybody comes through. I can probably take one more question, which will give people an opportunity to formulate their question, put their hand up in the chat to ask any of our panelists a question. If not, we're going to be winding down the show. Yeah, so we'll take one. If you've got one more question, someone's raised their hand. Okay, so I've got Yvonne DM. Hello, Yvonne. Welcome to the Queen's Health Talk. Hello, good morning. If you could say who you are and where you're calling in from, and if you could have your camera on, that would be wonderful, so we know who we're speaking to. I don't know. Rudy, could you unmute her? Maybe she's having difficulty on muting herself. Right, let's take another question, Nadia. I don't know what's happened there. Save the delay. If you've got one more question.
Oh gosh, you caught me there, haven't you? So we've done contraceptives, we've done the
if anybody, someone's got their hand up. Pauline Murray. Right, hold on. So Pauline Murray, if you'd like to put your camera on, say who you are, where you're calling in from, and ask your question. Pauline haven't. Right, Rudy, can you unmute Pauline, please, or unmute Yvonne, because people can't unmute themselves to ask the questions.
Could they put their camera on, please? Yvonne, I can't find you. What's the other person's name?
Pauline Murray.
The cameras are not on, so I'm going to have to try and go through the list.
Right, okay. Faye, would you like to come on the platform? Hello, good morning. Can you unmute yourself? No? Oh dear. No, can you find them, Rudy? You can't find them. Okay, let me go to the next one then. Apologies for this. Jacqueline A, I'm going to lower your hand.
Hi, can you hear me?
Hello, Faye.
Hi. Just a quick question.
Put your camera on so we can see you. Say hello.
No, not today. I'm in the bathroom.
Are you in the bathroom?
I'm just getting ready. But I just got a really general question. Right. And it's for both the doctors and the holistic therapists. Is the gap closing between the two? Because as you can imagine, 30 years ago, it was, they were quacks and blah, blah, blah. They weren't taken seriously. So is the gap closing? And, where do they have a good mish of the two? Or do they try one and if it doesn't work, go to the other? How are they working together now? Is my question.
Who would like to take that? Aaron, would you like to go first?
Yeah, so I do understand part of your question when you said in regards to trying two different were you talking in regards to trying two different treatments, or?
Well, the thing is, I mean, most people back in my day, they would try possibly the medical way, and if it doesn't work, go to the holistic way, and vice versa. And that's because they were never in agreement. I mean, I'd go to my doctor, and if I said, oh, I'm taking X natural remedies, they'd be like, oh, they're quacks, don't listen to them. So I'm wondering how it is the two of you are now working. Are you working closer together, or?
Yeah, so not, what I would say is, even though a lot of studies will say, for example, there's no evidence for certain holistic treatments working, it's not to say it doesn't work, it's just that not enough research has been done on those treatments to say definitely this should be, for example, suggested by the NHS. That's not to say that one is not, one can't try it. Absolutely, I'm personally for trying different methods. So based on evidence, if a patient came to me, I would suggest, you know, depending on the certain situation, because like I said, every patient is unique and the situation is unique to them. But I would suggest, you know, for example, pain relief, or you know, some form of contraception, or referring them on for possible surgery, depending on the situation. But if someone suggested trying something like acupuncture or what have you, I wouldn't be against that idea, because something like acupuncture has been proven to be beneficial in treatment of pain for other conditions, for example. So just because the research isn't out there to say for definite acupuncture can't be used to treat fibroid, it doesn't necessarily mean it's not the case. I think that there is room to try both of them at the same time, and not necessarily one.
Right.
It's down to you, really.
Right. You would never refer someone though?
No, because so like I said, with any treatment in the NHS, it's based on an evidence-based approach. So for a lot of things, unless there's enough of an evidence base to refer for that service, you wouldn't ideally do that. But it's not to say I wouldn't recommend trying it out of your own volition. It's just that it's not something that would be referred to via the NHS route, if that makes sense.
Right.
Thank you very much for that, Aaron, because we've got quite a few questions. I'm going to ask Yvonne DM. You should be able to unmute yourself now.
Yeah, hello there. Sorry, I can't come on camera. I'm sat here in my dressing gown.
Where are you calling in from?
Yeah, hi. I'm calling from South Nord, Crystal Palace border. Hi there, everyone. Just a question. I mean, I've had fibroids and all that stuff, and I've had hysterectomy, etc. Blah blah blah. It was one of the best things I did. I got my life back, so that was my choice, and I'm very happy. Now, one of the things I want to ask is, you speak. There was mention of balancing the hormones. I can't remember the presenter who gave the spring clean brief. I've used maca to balance my hormones. Can you give any other tips or natural ways to balance the hormones, which, as we know, affects hair, thinning, etc., dry skin, blah, 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 blah? Would we really appreciate some in-depth information on that? Thank you.
I won't go too much in depth because we're quite over time, but Imani...
Oh, sorry. Brief then.
Could either of you pick this one up? Imani, Valerie?
Oh, yeah, sorry. I didn't hear you call my name, sorry. In terms of tips, as I've mentioned before, that would be some herbs. Then there are some really good herbs out there that help balance hormones, but remember, this is a whole complete holistic approach. So you're looking at the 8 things that I mentioned. One of many, you know, diet is key, exercise and stress, de-stressing, because this all comes back to the other things that affect us. So it's not just a physical thing, it's a mental and emotional journey as well. So if you're going to give yourself a healing blueprint, as I call it, those are the 3 main factors you need to be looking at. So diet, hydration, getting enough sleep as well, and dealing with stress, because many of us don't really appreciate just how much stress we are under, to the point where we don't even think it's there, and it is. So I would say those are the key things to deal with. If Imani wants to add anything to that.
Thank you.
A nice short answer for me, please, Imani. Are you muted? Can you unmute yourself? Imani, are you there still? I'm sure you are. Okay, I'm going to move on to the next question then. Sonia Maynard, you could put your camera on, let us know where you're calling in from, and go ahead and ask your question. Sonia Maynard, are you unmuted? Right, apologies for that. Nana D, I'm going to lower your hand. If you could say good morning, say where you're calling in from and ask your question. Can we unmute you?
Hello.
Hi.
Sophia Maynard, can you hear me?
All right, we can hear you.
Sophia Maynard.
Hello.
Sorry, I've unmuted myself now. Yeah, I had fibroids in the past. I'm calling from Manchester in Stretford. I've had fibroids in the past, and I've had complications. I had this fibroid the size of a grapefruit. So I had they didn't offer me any other options. Sorry, I'm lying down. So basically, sorry?
What's your question?
Oh, I just wanted to know, is fibroids hereditary?
Thank you.
Because my daughter is having similar symptoms I had in my 20s. Heavy stomach cramps, heavy periods, severe pain in the lower region during her periods, clotting. So I just wanted to know, is it hereditary?
So let me ask, let me see. Kentucky? Would you like to pick up that question? Are you on mute? Oh, can you unmute yourself? Ask to unmute. Right, I've asked you to unmute. Can you? Yeah, you
Thank you. Yeah, I think the doctor's already said it, that yes, it can be hereditary, but sometimes when we say hereditary, it's to understand that the household that you live, or the person, just like with diabetes, they say it's hereditary, but actually when you live the same lifestyle, when you have similar stresses, then it can cause, you know, because you similar genetics, you know, so also so the factors that affect you are similar. So yes, you can talk about hereditary, but also the factors are similar. So yeah, but I think the doctor said it can run in families, but it's the reasons why it runs in the families.
Okay, thank you very much for that. J-Lo, I'll lower your hand if you can unmute yourself and say who you are, have your camera on, and quickly ask a question. Are you still there with us? Hello, is that J-Lo? No? Okay, I'm going to move on.
Hi.
Ah, you're there. Is that J-Lo?
It's Nana.
Nana.
Hi, good morning. I'm calling from Beckenham in the Bromley area, and I'm 27. So I just wanted to ask, I recently had a hysterectomy and hysteroscopy back in November because I was having very serious issues with bleeding and my periods. When they went in, they said they didn't find anything, even though my scans previously show issues. I came out of the operating theatre saying they didn't find anything. But since the hysterectomy, I have had no issues. Hysteroscopy, sorry, I haven't had a hysterectomy, hysteroscopy. I haven't had as much pain during my period, but I have increased pain.
My darling?
I got like a really painful ovulation. So I was just wondering, is there any way I can figure that out without going back to the doctors?
Right, Dora, would you like to pick that question up? Are you still there, Adora, or have you been muted?
I think I'm back.
You're
Hi.
back.
Hi. No, it's good. Clarification is really important because I was like, what on earth? Yeah, so I think with a hysteroscopy, it's good because what they can do is look at the uterus and see if there's anything obvious in the uterus itself that could be causing pain. I'm assuming you mean painful periods, right? Not painful ovulation. Yeah. I don't know that there isn't anything else I'd recommend doing that doesn't involve seeing a doctor and getting more investigations done. But I think this is something that's probably more specialist. The good thing is because they've done a hysteroscopy, we can rule out one of the 3 causes that we've spoken about today. So they can't see any fibroids. So we know that that's not something that's causing your pain. But one of the really common causes of pain, and I'm sure Aaron will chip in, is endometriosis. And like we were saying earlier, and the endometrial tissue, you expect to see it in the uterus, so they wouldn't necessarily find anything there. The problem is if you have issues with that sort of tissue outside of the uterus. So in the pelvis, sometimes people get bits of that sort of tissue in the bowels and, in different areas outside of the uterus. So I would actually go back and press on. To be honest, they do investigate those sorts of things, and it may well be. I know from the few jobs I've done in obs and gynae that in situations like this, depending on what they think is going on, they do explorative laparoscopies. So they go in through a keyhole and essentially have a look and see if they can find like any endometrial tissue, and they can try and laser it and blast it away and remove it, but that also has risk factors associated. So long-winded answer, but no, I don't think you can do anything without more medical help.
Thank you. I'm going to ask Pauline Murray because you've had your hand up for quite some time. Hello, Pauline. Welcome to the
Hello. Hello.
Good morning. Where are you coming in from?
I'm coming in from Northwest London.
Okay,
Hi, Jane.
Welcome. And what's your question?
Basically, I've got endometriosis and fibroids. Well, I have had, and I say that because in 2009, I had fibroids which they couldn't remove because of complications with operations in the past. Now I'm menopausal, and quite recently, over recent times, I've found out I have problems with my pituitary gland, which I'm having under investigation. What I'm looking to find out, is there some connection still from going from having your endometriosis and fibroids to going into menopause? Are there any connections there? And what can help that?
Who would like to pick that up?
Sorry, if I may ask, do you mean in connections as in does the fibroids or endometriosis get worse during menopause, or is there a link between menopause and fibroids? Just wanted to clarify, sorry.
Okay. Are there links to are there menopausal symptoms that are still linked to symptoms that you might be getting from the fibroids and endometriosis? Because I had, and why I think one of the reasons I'm asking that question is that I haven't heard you mention it, there's a blood test called CA125.
Yeah.
They test for a hormone thing, and I was checked with that a few years ago, just before I went into menopause actually, and it was very high, and they thought it was ovarian cancer, and it wasn't, and so they still said that my endometriosis was active, whilst I had a doctor saying it wasn't active before, but there was evidence to say it was active when I was in my early 50s. So I was just wondering, where's the cut-off point? Where does it cut off? Because there's a cut-off point from it, and does it link in then to the menopause if I couldn't have had an operation because of major issues beforehand? I wasn't recommended to have another operation to remove the fibroids, even though they wanted to.
So is there a short answer you can give to that? Because I'm going to take 2 more questions before we wrap up.
Yeah, I don't think there's a short answer, unfortunately. I think your case, and I'm sorry you've had to go through all that. I can only begin to imagine what you've gone through. It's really complicated because it's complicated by several different. You've got 2 really difficult conditions that you're dealing with at the same time. On top of that, you're going through it while you're going through the menopausal period. So I don't think there's a simple answer to that question. On top of it, you mentioned that they were investigating you for ovarian cancer, and the thing with ovarian cancer is it can have really non-specific symptoms as well. Like it can be something as simple as having bloating, or you can get tummy pain. So it's a difficult mixture.
Yeah, if that came up negative, what they're investigating now is I have a growth on my pituitary gland. So I was wondering if there's anything in connection with that as well.
So with the
I think you might need to have like a consultation, like for example with Kandaki, you can go through your whole medical history and probably and look at you holistically. I think it's quite difficult for any of the presenters to kind of like give, like you say, one word answer or even a couple of sentences, because I think your case is quite complex and you as an individual need to have some kind of thorough consultation, investigation, tests, etc. So, presenters, please put your details into the chat, and maybe it's worth you having a conversation with Kandaki or even one of the GPs or your own GP or even one of the other specialists that are on the platform. All right, my darling.
Thank you. Thanks a lot. Thanks a lot.
Mobs H.
Hi there.
Hello. Good morning.
Hi. Good morning. I'm calling from Bedfordshire.
Oh, hi.
Hi there. Well, my question is, kind of you're short for time, is I was diagnosed with polycystic ovaries in my early 20s. However, as the time has gone on, when I've been tested for it again, because I got tested when I was at university, when I got home, my home physician got tested again. They said I didn't have the polycystic ovaries. Is it possible that what their level of high testosterone I don't have, or whatever's high for me isn't high for them? Because since then I've also developed fibroids, which have, thank God, were removed. Subsequently I fell pregnant afterwards, but is there the possibility that to have polycystic ovary syndrome can still be suffered later on, just the testosterone level isn't as high as their criteria is?
I don't know. Do you guys understand the question?
I do, I think. But I think this depends on, of those main symptoms of PCOS, which ones they diagnosed you off the basis of, if that makes sense. Because it's hard to say exactly. So did they tell you, do you have irregular periods? Were there multiple cysts on your ovaries?
There was multiple cysts on the ovaries, and that's where I believe they initially brought that in. However, the whole weight side of it, I suffer from. I never got the excessive hair, you know what I mean, the excessive hair all over the body. I never got that. So chest and face, I never got that. But the whole weight gain, the way how my body responded to that, the insulin resistance, I have all of that.
Okay. So if you have insulin resistance and you have multiple cysts on your ovaries, then that's enough for the diagnosis, regardless of if the the testosterone levels are down. I don't know periods.
Oh, I can't.
Sorry?
I don't know if you mentioned your periods. Are they regular?
Sorry, hold on one sec.
At the time, my periods were regular, but they were irregular, if that makes sense. So basically, I could time it. One would come 21 days, another one would come 28, and one would come 32, and it would go in a cycle like that. But I was able to track it, so it was regular but irregular, if that makes any sense.
Regularly regular, yeah. I think I would say it is always hard with PCOS, but I think ultimately if you have the insulin resistance and you have polycystic ovaries, I would say that that's enough. I don't know if you'd add anything, Aaron, but the sex hormones and the androgens and things like that for some people, they actually just go based on the clinical presentation. So if they can see the hair or see acne, etc., for some people that's enough. Some people will want actual facts and figures, but I would say that the insulin resistance and the cyst is probably enough to say that you have that diagnosis.
Okay, thank you very much for that. I'm going to quickly move on because I'm conscious of time. Natty, you've got your hand up. I'm going to ask you to unmute. So Natik, if you could quickly ask your question, maybe we can get some relatively short answers. Are you there? Natty? No. Okay, I'm going to ask Doretta Maynard.
Yeah. Hello. Hello, everybody. I'm Doretta Maynard Hampton, calling from Manchester. I'm from Manchester. Hi there. Good morning, everybody in Queens and Kings and Queens. My question is, why do some women not experience the changes going towards menopause? So there's no cold sweats, there's no tiredness, there's no nothing. But the only thing that changes is that their periods stop. And then in their late 50s, they become pregnant, but they get pregnant twice. And they end up having miscarriages. Why does that happen? And if they didn't have the miscarriage, would the baby be healthy?
An interesting one.
Thank you.
Who would like to pick that up?
I will try my hardest to answer that question, but it's a very interesting question. Very, very good question. There were different. Sorry, my memory is not the best. If you could break up the question, what was the first part of the question? Sorry.
Well, the first part is why some women experience nothing at all to do with menopause, but yet the periods stop, and when they go and get the test, they're being told you've gone through menopause, but they've not experienced anything.
Yeah. So with menopause, you don't necessarily need to diagnose it through the test. Usually it's just a clinical diagnosis based on symptoms. And sometimes, even though the hormone level just otherwise, it's usually your symptoms that is the best indicator. I think in regards to why some people experience it differently, what I will say is everyone is different. So what's driving your menopause is the lowering of your estrogen, because your eggs aren't producing it anymore, and women. All of you are going to do that at different rates. None of you are ever going to do that at the same rates. So that's part of the reason why, you're going to experience these symptoms differently, because estrogen is what is related to this process. So if it's different in different people, then you're going to experience it differently.
Does exercise have anything to do with that as well? The fact that you're quite mobile, you exercise all the time, you're quite fit, because sometimes that's what the doctors say, it's because you're quite fit while you're not feeling the symptoms of cold sweat, sweating and things like that, and tiredness, and you're quite still bouncy, and they always say your metabolism is still quite high. You've got a metabolism of the rate of a 19-year-old, and you're in your 50s and you're thinking, when is it going to change? You've been a size 6 or size 8 for a long time, and then when you get to your 50s, you then become a size 10, and you think you're big, but you're not. But it's because you've gone from a size 6 to a size 10. But they say that's normal for your age, but it doesn't mean that it's menopause. And then when they do the test, they say you've been through the menopause, it's finished, it's done, blah, 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 blah. But yet you still go on to get pregnant twice in your late 50s. And in those times you've miscarried.
Things like exercise can be important, because part of the issue with menopause is changes in your mood as well. So things like exercise and stress release can play a role in mitigating some of those symptoms that you can experience during menopause. So yeah, to answer your question, yeah, things like exercise are definitely important in determining how your body responds to the changes that are happening to you.
So why do they still go on to get pregnant then, even though they've gone through menopause? How come?
Thank you very much. We're going to have to wrap up because it's after 11 now. I'm going to ask each presenter to give a parting message, a take-home message, before I wind the platform down. So, Kandaki, would you like to kick off first? What's your parting message to the guests on the platform?
Okay, so I would say that more than now than ever, it's so important that you look at a more holistic way to approach your health and well-being. Just like the lady who spoke about menopause and the other lady who asked about alternatives to pain and so forth, remember that our diet and our foods are the natural things that we take into our body, and that the pharmaceuticals are based on the natural world to affect the same things in the body that plants and herbs do. So your job is to understand the natural world more and how it affects you, including things like stress and so forth. So That's my take-home message. Know more about natural health. It will help you in the future. Thank you.
Fantastic. Thank you, my queen. Aaron, what is your parting gift, your parting message to guests on the platform?
Yeah, what I'll say is, I know it's a cheesy comment, but health is wealth. As I mentioned in my presentation, there's some things that are outside of your control, and that's fine. But there are lots of things you guys can do to not just improve your risk, reduce your risk of getting things like fibroids and endometriosis, but there's so many things you can do to mitigate the risk of developing lots of medical conditions that affect Black people in general. And I think what a lot of us have said today is lifestyle modification, exercise, stress release. Those are crucial things. So by all means, get on that, because it's really important for you.
Thank you so much. Adora, beautiful Adora.
I agree. No, 100%. I think everybody's, touched on so many important points. I think often there can be this idea that as doctors, we're just trying to cram medication down your throat and, cram surgery and all of these unnecessary things down your throat. And I think, it's important to realize that they're there for a reason. There are, some cases where people will need that regardless of lifestyle modifications, but it's certainly not a one size fits all for everybody. Even with PCOS, the vast majority of people may not have symptoms, and it may not find that their fertility is affected. And a big part of that will be down to lifestyle changes, if that makes sense. So, it's just balancing and bearing that in mind. We can only do the best that we can do in terms of looking after ourselves, making sure our diet and our exercise and everything is working together to bring our, insulin levels down, sugar levels down, and all that sort of thing, because we can't control that. But if you do need further help, go and see your GP.
Fantastic. Thank you very much for that. Imani, Queen Imani, what is your parting message to the guests on the platform, my darling? And I know you're there. Are you there? You might need to unmute yourself. Valerie, what is your parting message to the guests on the platform?
Mine is quite simple. It's detox, detox, detox. So, detox your mind, the emotional detox, the physical detox, and the mental detox as well. It is fundamental to healing that we now start looking after ourselves and taking responsibility for our health and our well-being as well. And that's it, as simple as that.
Wonderful, thank you. So I want to thank all the presenters this morning on the platform. Not sure where, I can't find Imani here. Thank all the presenters for the wealth of information and knowledge you've impacted on us. Hopefully you've all made loads of notes. You'll go away and, put a lot of what's been said to you into practice. Detox, it's a holistic approach. It's about your diet, sleep, drinking the water. We say it time and time again, almost every week. It's the same message that keeps coming out, in regards to all these different topics that we talk about every week. So I just want to wish you all a fantastic Saturday. Enjoy yourselves, and do put these things into practice. If you want to try and have optimum health, you've got to make that change. It's changing the mindset. So thank you all very much for being on the platform. And I'll just quickly say, to hear about Future Queens Walking Group Zooms, please follow us on Eventbrite, so you'll get the instant notification come out to you in your email once we put up, the next subject that we're going to be discussing, the next event we're going to be broadcast on Saturday morning. This Zoom event has been recorded and will be going up onto our YouTube channel. There's quite a few Zoom recordings up on the channel already, so please go on, like, subscribe, share, comment. That would be fantastic. And I just need to bid you all a wonderful, wonderful Saturday. And also, before I don't forget, if anybody wants to join me in March on the King's Queens 30-day intermittent fasting challenge, please get in touch. Yeah, we've got a few spaces left. So have a wonderful day, everybody. Take care. And until we meet again, enjoy your Saturday. Take care, everybody. Bye-bye. Bye.